this mean? It poses a great risk. We are still developing, and we are prone to consequences of conceiving at a very tender age. 10% of adolescents, 15 to 19, have, this one I've already stated, but we also have to be mindful that 35% will have started their sexual encounter by 18 years. This statistic is not good. And when it gets to services, for those in the reproductive age, the married and the unmarried, seeking services specifically to prevent pregnancy, we still find the figures are low. And the contraceptive use among women in union, we are finding it at 25%. And the consequences of getting pregnant at such a tender age is reflected in the young people's contribution to maternal mortality. 17.2% of the deaths, if you look at women who die due to pregnancy-related illnesses, every 1 in 4 girls get pregnant. If you refer to the 2016 UDHS, Uganda Demographic and Health Survey, the teenage pregnancy rate was at 25. Come to 2022, it is at 24, just 1% decline. We need to do a lot. We don't want our young girls to die. We want them to reach their full potential. And we know that the pregnancy cannot be obtained by an individual. It takes two. So even the teenage boys contribute significantly. We have issues of school dropout, and we still have challenges around sanitation. And sanitation, what does this mean? It contributes to challenges in menstrual health hygiene, especially for the girls. And this is a contributor to school dropout, absenteeism. So when we look at these statistics, together we need to understand as young people and the consequences in terms of the development of the country. HIV positive, if we look at our data from the District Health Information System 2, 2025, over 8,000 adolescents tested HIV positive. These are alarming statistics, and they are human beings. So young people, please take note. We encourage you to make informed decision. HIV/AIDS is still with us, and we know how the major mode of transmission. So in terms of, if you look at this other side, extreme right, what are the drivers? The drivers to contributing to some of these adolescent health issues. Poverty, but that is not what we should always front. And poverty, some adolescents and young people are lured into sexual encounter because of a chapati. Issues of gender inequality, school dropout, harmful cultural practices and norms, limited access to information. That is why we're bringing all sectors together so that each of us contributes to these painful statistics. So the work, effort, and investment needed to address this still enormous. We really need to see that these statistics go down. I can now dive into the objectives, but I thought I needed to set the ground. The reason we are here this morning is we want to share the progress. Last year, about the same time, we had a pre-youth event and we committed. So part of our discussions is how far have we moved with these commitments. But this has not only left us with the progress, there are innovations to address some of the issues around poverty, the barriers that lead to teenage pregnancy. So we are to showcase innovations, and we could adopt some of these and get back to our respective workplaces and we implement. We want to foster intersectoral collaboration. The mix and mingling, please get contacts of people who can support you, who can guide you, who can provide information. That is why it is a mix of different institutions, different sectors, religious, culture. We have jailers that protect us, police, Madam Maureen, to develop this year's communique. So by the end of today, we shall have come up with a commitment that we need to fast track for next year. So that is why we are here for this conference. It's not only about meeting, but we need to ensure that we tick off. That takes to our expected outcome. Next slide, please. So as the slide comes on, we must have agreed. One, strengthen multi-sectoral implementation and follow-up. Since we are all going to be in one house, whatever we agree on, if it is led by a sector, the sector will lead us through for next year. We have a national adolescent health costed implementation plan, which is the guiding document. It is a 5-year plan. We are going to launch it. It has been very consultative. It is multi-sectoral in nature. We are disseminating, we are launching it. The innovations that are going to be displayed, that we need to adopt and scale for improved adolescent and school health. We are expected to come up with a communique or a statement, an outcome statement, which we are going to share or present in the main conference that starts tomorrow. And we'll definitely have a report. So thank you very much for listening. That is why we are here. And let's listen in attentively and let's contribute. Thank you. Over to...
Thank you. Let's give a big hand to Dr. Ladies and gentlemen, a big hand. Okay, thank you. And Doctor, as you were doing the presentation, Aaron and Sisi came in. Aaron and Sisi, please, let's get on the stage for that poem. Now, two reminders. people from Buyende. You see, in Buyende, we don't put water in bottles. In bottles, muba muwara G. So people from Buyende are fearing to take this. This is water, please. Buyende, take the water. Okay. Another reminder, is any one of us missing a t-shirt? If you don't have a t-shirt, please put up your hand. It means all of us have t-shirts. Those t-shirts have been given to you to put on while here. Please put them on. Put on those t-shirts. For branding purposes, you must look the same. We must look here. Thank you so much. Over to these young people, Aaron and CC.
Good morning, everybody. Yeah. So, before you are going to present our poem, but it's more than just words. It's going to be on meaningful youth participation, and I encourage you to listen deeply.
Before the speeches,
Data and policies unfold, we bring you our youth voice, virgin and full of poise. We bring you energy.
we bring you the fresh beginning of our story.
Our stories that do not wait to be told, to be said, to be laid in ways that do not represent us. For our narratives define who we were, who we are, and who we shall be. Today in this room we will speak statistics. We will speak numbers and graphs and quotations. But remember, behind every number or figure is a face like mine. Human, young, hopeful, ready,
dreaming,
daring, becoming,
but
but
needing
needing
of
of
direction,
direction, affection, correction. We look up to tables like these to
guide
guide
us,
us,
to
titles like yours to guide us,
to
to
hold
hold
our hands, to sit
sit
with
with
us.
us. Can we dine on the dinner where decisions are made, especially when those decisions are about us?
Today, as we dialogue and dine, we choose to stand against unfriendly health services that drive adolescents away. We choose to stand against information gaps, policy gaps, harmful norms, violence, hunger. Remember your commitment and promises you made. Remember the gains you have made. Remember me. Remember my voice.
Remember we were here,
We showed up, not
not
as
as
guests,
guests,
but partners on this playing
field.
The
The
future
future is near. The future is young and
and
calling.
calling.
And
It
it
is
will
going to take the two of
us
us to answer that call. Thank
Thank
you.
you.
Pascal. Was that a big enough clap for these two young people? Okay. Aaron, what do you do during daytime?
During daytime. So I have, can I say, two professions. I am a young peer adult support person with Uganda Cares. That's at Chitante. But I'm also a final year student at Chambogo, and I'm pursuing a bachelor's in demography and reproductive health.
So someone has said, I tap into that blessing. Just tap into that. Pass the mic to CC. During daytime, what do you do?
During daytime, I studied catering and hotel management. So during daytime, I do out some cakes and some other bites that follow.
And during at night, you serve them out.
No. No, I serve them out, but I'm also a youth leader at AHF Uganda Cares, Sentivali Kudembe.
So how do the two of you get together to do the poem?
Of course, we met at our mother place. That is the head office, the secretariat
Okay.
at Chitante. So we met and we carried on that work.
What is that thing that you hate about being a young person?
Now, for me, one is whenever I try to speak your mind, at times people take it like you're disrespecting them.
So people do not take your views seriously.
Yes.
Okay. What is it that you hate about being young?
We are always judged, even though you're not in a mistake.
Always judged, even though you're not in them. Are you speaking to someone here? We always judge them, even if they are not in a mistake. Your views are not taken into consideration on many occasions. Is this the reason why the poem? Because you did a poem about meaningful youth participation. Is that the reason why?
Yes. You can bring it from that.
Let's give them a bigger hand, ladies and gentlemen. Aaron and Cece. In the house, we have Pablo. We have Pablo in the house. Let's give Pablo a big hand. Pablo, where are you? You appeared and disappeared. You are there, but people are not seeing you. You come in front and people see you. Pablo is in the house. Now, those of you who are not my age do not know who I am. Pablo, say hi to the people.
Hi.
Nebila, yongerako.
Wow, I'm excited to be here. My name is Kenneth Chumuli, also known as Pablo. And for those who used to listen to radio at the beginning of the century, remember radio drama called Rock Point 256, yeah? So I used to be the productions director at the time, and I'm still a youth. As long as you're 99 and below, you're a youth. Yeah, that's what I was told. Well, in the midst today, we also have young people from Nagoro Teenage Center that I've been working with, and the program they also have a skill that they'll be presenting, and yeah, uh, we'll get to taste the pudding at that time. So back to you, Amon.
When I asked him when he had just come in, the question was, "How is your family?" What did you respond?
I said it's growing in terms of height, not numbers. They are still constant.
So
You
when
know, there's a new method of family planning called school fees. They never talk about it. So that I just get to know it.
Thank you so much, Pablo. Let's
Thank
give
you.
a big hand to Pablo. For once, I've made him do work without being paid. Okay. So in our midst, we have the Sebei chiefdom leader. Let's recognize his arrival with a big hand, ladies and gentlemen. Where is my group from ADRA? Because in the next 5 minutes, we'll be having break tea. My group from ADRA, please, they'll be giving us a poem. One more time, those of us who came in after I'd introduced myself, my name is Amon Muliowa, but young people in this world are not good at all. They pronounce my name wrongly. They call me Amon. My name is Amon Muliowa. I do sexual reproductive health. I'm a trainer. I do social behavior change communication. But currently, I work with an organization called the Border Union. So I'm a senior border rider. ADRA, you're the reason I'm saying all this. I wouldn't have said it otherwise. Where are you? Should we? Oh, yes. Very smartly dressed. If you have a t-shirt and you have not put it on, the other thing I do during the time, I'm a teacher. I move with my kanyaf. Over to you. You need another mic? Okay. Here. You don't need it? All right. Is it on? Good. Close.
Good day to you all, ladies and gentlemen. My name is Adoch Gloria, and
Achomo Sharon Lake.
we are the student of Palabeko Gili Secondary School, found in Lamour. And we are in front of you today with the support from ADRA.
We have come to present for you a poem entitled Nourishing the Future.
Tiny hand, hold tight. Mother's gift, pure delight. Breast milk, flow rich and free. Making our babies not to be malnourished, but making them to be the healthy generations to come.
But are we supporting breastfeeding mothers? Men, do you do your work? Workplaces, do you give time to the breastfeeding mothers? Communities, do you care for them? Healthcare providers, do you really give time for the breastfeeding mothers? Policymakers, what are you doing?
If not, do we know that we can support them? Men, provide the nutritious food needed for the breastfeeding mothers. Workplaces, please open your eyes and gazette areas in workplace for mothers to breastfeed. Because we are crying today for the healthier Uganda. But one thing that you should know, that breast milk contain all the food values. Healthcare providers, please, I beg, help the breastfeeding mothers to start breastfeeding within the first 1 hour after giving birth. Policymaker, why are you quiet? Stand up onto your feet and make policy that support breastfeeding, like parental leave policy.
Let's rise up and support breastfeeding mothers. Our government, help us provide healthcare budgets that accommodate essential breastfeeding practices. Men, yes, provide nutritious food for the breastfeeding mothers. Communities, let's promote health practices, breastfeeding practices. Yes, let's promote breastfeeding practices through encouragement by peer to sustain breastfeeding.
Do we know that breast milk also help to protect the environment? It also creates strong relationship between the mother and the child. It also help the child to grow up healthy and wise. Breast milk, the healthiest food in the world. Prioritizing breastfeeding is the key to healthy generation and wise creation.
Thanks.
Why you run away? You come back here.
The international boy, DJ Perez.
It's very important.
Yeah.
So are you telling me when I go back home I should go and breastfeed?
You as a father, you are
Because
supposed to provide a mama who is breastfeeding a child with the nutritious food needed.
me as a father,
Yeah.
I don't want to tell you what fathers do to the breast milk. I don't want to tell you.
But there's one thing that you are supposed to know, that once a mother is breastfeeding a child, it reduces the expenses in the family because you will not waste money buying a meal for the baby. The only money you will use just to buy some little green vegetable and just little meat for the mother.
You are,
And that is
you a
all.
are you a mother? How did you know this?
I'm not a mother, but I believe in myself. Time will come when I get married. I will give
Amen.
birth to a child.
Oh, let's give it a big hand, ladies and gentlemen. You said I don't know, it might not have been you, decide breast milk also, breastfeeding breast milk helps conserve the environment. How does that happen?
L-
Breast milk, breastfeeding.
Listen
Now,
here.
environment.
You as a father taking care of a breastfeeding mother.
Uh-huh.
Uh-huh. A mother will claim and say that, no, I want to protect my figure. I am a working class.
Hmm?
And you as a father, you say, right, my wife is supposed to be in that good figure. You will decide to start feeding a child with that bottled milk. And when you go to the market, you will not go with your hand and they said, bring your hand so that we serve you with the milk. You will find it already packed wherever in the bottle or in the sacket. And when you take it home, the baby will drink it. After the baby has taken it, you will dump all those sackets away, which will end up polluting our environment.
Which class are you?
I'm in S3.
Which class are you?
I'm in senior one.
Oh, senior one. Let's give the senior one a bigger hand, ladies and gentlemen. When you grow up finally, do you have intentions of becoming a politician?
Yeah, in my school, even I'm the head girl.
Thank you so much. Thank you. Ladies and gentlemen, break tea has been served. Break tea has been served. We're going to have a break tea right from the area where we're doing our registration. We're giving it strictly a few minutes, and after that, we should be right back. One more time, you're welcome to the Adolescent and Youth Conference. Exceptional Motherhood event under the theme Strengthening Multi-sectoral Approaches. Reverend is here.
DJ, stop it.
In the name of the Father, the Son, and the Holy Spirit. Lord, our Heavenly Father, we thank you for the break tea you have prepared for us. May you sanctify it for our strength to serve you and also conduct a successful conference. Through the name of our Lord, we pray.
Amen. Let's go for the tea. DJ.
And I hope the Reverend shall be number one there because that's the protocol.
We have informed that as we wait for the scripture on the card, because the card is not the card. If you put out the card, put out the card, the not clear the place. It's not clear the place. You don't have the trees. Let's have the card.
Then goes one, I'll make it touch it, touch it, touch it. DJ Perez in the mix.
Touch it. With the girl, point on the bucket. Then goes one, I'll make it touch it, touch it, touch it, touch it, touch it, touch it, touch it.
Those lovely young people from the center who are going to be part of this. Instagram, DJ Stampede.
Nobody like me is freaking fantastic. Touch it, touch it, touch it, touch it, touch it, touch it. Say you never ever go to
Those lovely young people from the Continent Center who are going to be part of the scheme, please come here now.
Stay loving me globally. You want me
Instagram, DJ Stampede.
Nobody like me is freaking fantastic. You don't need me. Oh, Uniform men, Oluwa can you fix the problem? Thunder, fire, diarism. Where they give teacher, make you leave me. Thunder, fire, diarism. I thought we in this together. Give you my necklace, better. Give you my last cash, better. I show you my best friend. I thought we in this together. Give you my necklace, better. Show you my best friend. I give you my last cash, better. Everything I do, I
The international boy, DJ Perez.
Follow on Instagram at DJ Starby.
I used the money, I get it here. Since the inception of this project in 2022, we have moved miles, tremendous impact. I would say that we can attribute to the contribution of the CISWAS project in the region. We have seen young people being empowered and young girls accessing sexual reproductive health services and commodity in the facilities. We have also seen transformation in the lives and behaviors of young adolescent boys. And we have seen young people who are skilled, who are able now to meet their daily needs by the skills that they have got and the savings that they have earned from these skills that they've got. So I would say broadly, the CISWAS project is impacting in the lives of the young people and also contributing to access for sexual reproductive health services in our health facilities.
In the heart of Sebei region, where rolling green hills stretch endlessly and waterfalls carve through rocky cliffs, life unfolds in breathtaking beauty. Yet beneath the serene landscape, in hidden caves and remote villages, a painful tradition continues, one that has shaped generations.
FGM and child marriage are rooted in the people of this region.
The thing to show that you are now offered to be married is the circumcision.
I said that before we start with women, we sleep with them the whole night. Very early in the morning, we bring them to the river.
Female genital mutilation, or FGM, is deeply rooted in the culture of the Sebei people. Meet Jesser Sauda, a reformed FGM surgeon who started the practice in 1997. She was young, eager to learn, and believed she was preserving the culture of the Sebei people. For years, she relied on the practice for financial survival, earning respect and recognition as a skilled traditional surgeon.
Okay, help me because I don't have somewhere to survive. If someone has another girl has come to me to give me something and then they help me. Now, this exercise brought a lot of losses. Some girls can die. Some can get married when still young. I have now.
Today, Sauda is reformed. She has abandoned the blade and now speaks out against FGM. She teaches communities about the dangers of the practice and advocates for alternative rites of passage.
Now I'm advising my fellow people to stop cutting girls and they inject them with truth.
FGM, because it's in culture, it's taking us back to 8 years. FGM has gradually led to death. This is due to overbleeding, where after circumcision, girls can overbleed.
If you cut a girl, there is somewhere where the knife cannot reach. And if you cut there, the girl dies. And if the girl, you examine very well that Is she pregnant? And if she is pregnant and you fast, she dies because she bleeds until she dies.
Girls like Cherub Jemima are not only realizing the
lead to death. This is due to overbleeding, where after circumcision, girls can overbleed.
If you cut a girl, there is somewhere where the knife cannot reach. And if you cut there, the girl dies. And if the girl, you examine very well that, is she pregnant? And if she is pregnant and you fast, she dies because she bleeds until she dies.
Girls like Cherub Jemima are not only realizing the dangers of FGM, but are also taking action. They are mobilizing peers, engaging with community leaders, and advocating for lasting change. Their voices are breaking the silence, paving the way for a future free from FGM.
The government should come out with sponsorship programs, because most of our parents believe that they are poor and they believe they cannot take us to higher schools because they have no money. So if the government comes in and they give us sponsorships, we can be able to study, and most of us can get to know the side effects of FGM, of circumcision, and we can get out of it.
Religious faith-based organizations here in Bukwa who have been talking to our elders that please try to live this culture of mutilating our child. Number two, actually we have been talking and advocating for thanking the government of Uganda, bringing in the BDM. Actually, this aspect of grouping, actually identifying the people, these are the surgeons and the mentors for FGM. If we bring them as a cluster and give them this BDM funds, I think slowly this cry of maybe the promises that have not fulfilled the promises, it will come down, it will decrease.
And the key message that I want to pass out is that the way the world is moving, this should be to our people, my people, the Sabines, and other people who are still hiding this thing, because now it was outlawed. It should not be. There is nothing good in doing this. I don't know why our people are still sticking to this. But when you move out, it is not so much, but there are those who are still hiding it. We should come out, we should leave it, we should drop it completely, because that is how even God wants us to be. We should appreciate God's creation. We should not tamper with it. That is something that we should appreciate, and we should go by it.
As an organization with support from UNFPA, we are committed to ending FGM, or female genital mutilation, in the Sabay region. Through education, advocacy, and community dialogues, we work hand in hand with former practitioners, young activists, religious leaders, and families to create lasting change.
In Karamoja, that all my children are vaccinated to keep them safe from disease.
Early sexual activity leads to health risks, such as increased HIV infections rates, unplanned pregnancies which end in unsafe abortions, a leading cause of maternal death among young people, and 60% of unintended pregnancies are among adolescents.
No adolescent girl should be pregnant. No adolescent boy should be a father.
This leads to a never-ending cycle of poverty and mental illness that accompanies the stigma, neglect that young mothers face in our society.
No woman or child should die during pregnancy or childbirth.
In Uganda, 1 in 4 adolescent girls aged 15 to 19 years are pregnant, and 7% are married before the age of 18.
To me, safe motherhood means young people should access sexual reproductive health information
which is appropriate from the right service providers and also services when they need them.
Safe motherhood is about having my newborn baby safe after childbirth.
Ensuring that all my children are vaccinated to keep them safe from disease.
Early sexual activity leads to health risks, such as increased HIV infections rates, unplanned pregnancies which end in unsafe abortions, a leading cause of maternal death among young people, and 60% of unintended pregnancies are among adolescents.
No adolescent girl should be pregnant. No adolescent boy should be a father.
This leads to a never-ending cycle of poverty and mental illness that accompanies the stigma, neglect that young mothers face in our society.
Safe motherhood also means freedom for me to use which family planning method I can use.
Teenage pregnancies contribute 24% of maternal deaths in Uganda. Babies born to teen mothers are often born too soon.
For the adolescent,
having a good start using nutrition as a foundation.
Before, during, and after pregnancy, to ensure that the mother and the baby
can have an enjoyable pregnancy and also have a fruitful birth.
To me, safe motherhood is attending 8 antenatal visits and delivering your baby in a health facility.
Having my partner accompany me to the hospital during birth.
It is about ensuring that my partner accesses a health facility whenever they are required to.
Safe motherhood is all about a pregnant woman delivering in a pair of safe, skilled hands. So, visit the nearest hospital if you should deliver a baby.
To me, safe motherhood means every girl stays in school and attains their best potential, or they return back to school.
We must act together in a multi-sectoral approach. Parents, the media, religious and cultural leaders, to prevent teenage pregnancy and protect the future of our young people. Thank you, Navio, for joining this course as a male influencer in safe motherhood.
We are able to interact with the refugees. At the beginning, the uptake of contraceptive was a challenge in the refugees. But as we engage the different leadership, mindset changes has taken place. And even now, as we talk, the demand for services is there.
We've worked closely with UNFPA under the SAY program with the implementing partners. We have worked alongside them in implementing capacity building for our frontline healthcare workers, especially the midwifery staff and the medical officers.
When you come like this particular facility, even as carry at the gate, understand the basic SRS information, including other provision of services. Because if the young people come to an institution, any point of entry, they should be attended to. And that is the area that I appreciated, the quality of mentorship.
Our facility has seen an increase in family planning uptake from 27.5% to 47.8%, and that is total family planning uptake. But among young people, it has also increased because every day, because our message has been continuous, every day we receive like 2 young people within the age of 16 to 19 receiving family planning.
The work between the local government, the CSOs, and the local partners, and how it impacts young people. For example, in Lamu district, because of the empowerment the role model boys have received, they are able to mobilize their own communities and start teaching on sexual and reproductive health.
The SAFE program is going on well on my side in Akor Health Center 3. More youths are coming to the facility to get the service at the right time. I will also make referrals to them, sometimes on the family planning, those who are eligible to get the family planning methods.
As a role model for the boys, after getting the training, I managed to change the life of various young boys whose life was about to be spoiled.
I was once a drunkard, but now through the program they gave me, when you're like a drug addict, it's difficult for you and from parents, and may also cause parental denial. from home. And I was someone who is neglected. But now we are together with my mom. Thrive and care local collaboration is so good in my sub-county. There's a lot of changes that is being brought. We have reduced gender-based violence due to this collaboration.
Project ni wakonyo dano me kin gang me community ma megwa kin lok me kuku. Atie bene gi family chiel madong olo akonyo gi ikit me kuku ma yot olo kumbeti go dwaka chaden ma aloga ti mabe twogi and go wacha bene ni almost dong gidonyo ga yolega madong gi chok twang la gi tindi.
This model man has helped my family in teaching us about domestic violence, whereby we have now restrained from such act. It has helped us to unite together with my madam, and at the moment, as I talk right now, we are preparing to wed in church.
When we came and we launched the project, of course, we identified our volunteers, we trained them. After training them for the YSLA group, we put the girls into groups where we started the saving.
This project has brought a great change. I'm seeing even in my group, most of the members, they are now doing their own business. We help them in saving, and they now have access to go to the hospital to assist for the health care.
We have our YSLA agent. Upon receiving the training, and when she received a training allowance, she realized that she can do something that can take her to the next level. Now she has started a small business that she's running.
Time back, we have been receiving food from World Food Program. But when this project came in, unfortunately, the food has been canceled. So the project has helped this youth to get their own money, to struggle for their own. Even if the food is not there, they can survive in the settlement.
We work with the school health and sanitation clubs. And when we go to those schools, we provide information on menstrual hygiene management, but also teach the members of the school health club on making reusable sanitary pads.
I want to send my words of appreciations to the SAY for their support to the young girls for what they have done. It has also supported us financially. It has helped. It has reduced that burden of buying pads.
When young people and leaders unite together, great things happen together. As SAY project, we are better together when we are delivering together.
My name is Dr. Sabrina Chitaka. I am a pediatrician. I'm also an adolescent medicine specialist. Today I'm here to talk about sexually transmitted infections. I know the common ones you know are gonorrhea and syphilis and HIV, but there are others like chlamydia, trichomonas vaginalis, genital herpes, herpes simplex, the works. I'm not here to scare you, but sexually transmitted infections are really common especially among young people and college students. Some of these infections cannot be cured, such as HIV. Therefore, if you feel unwell, if you have a sore on your genitalia, if you have rashes that you do not know about, make sure you see a healthcare provider who will test you and start you on treatment. And also make sure that your partner is also treated. As Ugandans, we must ensure that the young generation grows and grows up to reach their fullest potential. As parents, it is your responsibility primarily.
It has reduced that burden of buying pads.
SAY program, delivering better together. When young people and leaders unite together, great things happen together. As SAY project, we are better together when we are delivering together.
My My name is Dr. Sabrina Chitaka. I am a pediatrician. I'm also an adolescent medicine specialist. Today I'm here to talk about sexually transmitted infections. The common ones you know are gonorrhea and syphilis and HIV, but there are others like chlamydia, trichomonas vaginalis, genital herpes, herpes simplex, the works. I'm not here to scare you, but sexually transmitted infections are really common especially among young people and college students. Some of these infections cannot be cured, such as HIV. Therefore, if you feel unwell, if you have a sore on your genitalia, if you have rashes that you do not know about, make sure you see a healthcare provider who will test you and start you on treatment. And also make sure that your partner is also treated. Then must ensure that the young generation grows up to reach their fullest potential. As parents, it is your responsibility primarily to talk to our children about preventing them from getting sexually transmitted infections. They can wait, and waiting is hopeful. Teachers, religious leaders, be part of this call to action to ensure that our young people stay healthy. We are all in this together. We must protect them. We must make sure that they are healthy. And in being healthy, we need to support them to be part of the change that we want to see. STIs can be treated, but some have no cure. Do not forget that.
My name is Diana Ondoga. I serve as Manager, Corporate Social Investment at Stanbic Bank. Anyone between the ages of 13 to 19 is at risk of gender-based violence. It can happen at home, it can happen in church, it can happen at school. Are you a parent? Are you a teacher? Are you a primary caregiver? Are you a community leader? Are you a leader in the church? We have a responsibility. We have a responsibility to look after our future through protecting the children against gender-based violence. The three forms of gender-based violence, physical, social, emotional, or psychosocial, are things that we can do something about.
All right.
We live in communities where this is happening in our neighborhood. Do not be quiet about it.
Diana,
Do something. Say something. Speak up and let us be champions for creating equal opportunities and fighting against gender-based violence.
And I'm happy you are here. Those of us who joined us during the tea break, we started a long time, and without wasting any much more time, this is the Adolescent and Youth Conference at the Safe Motherhood pre-event, running under the theme Strengthening Multi-sectoral Approaches to improve adolescent health and well-being.
My name is John Magezi.
We have a packed program coming on after break.
28 years.
And without wasting any much more time, please tell your colleague who's still having tea to get in, because we are starting in a few seconds. Allow me hand over.
25%
hand over to my friend.
Of girls under 18 get pregnant when they are still young people and they cannot manage the challenges of pregnancy.
The rest
but I want to
address
the young girls that learn to understand that even when you take
Thank you very much. This is on the MC. Coming in as the dangerous substitute, just like last year. So we've flipped the gender a bit as we wait for the commissioner to come in, who is to chair the session. We will kick off the break off with a young person who is a poet. Please come and take over. Then after that, we'll have the Minister of Health from Trinity College, Nabingo, Nagawa Evita. Please get ready. The poet, you can come and take over. Thank you very much. Please, let's clap for her as other people are coming in.
Good morning, everyone. Is it morning? I don't know. Oh, it's morning, eh? Okay, my name is Gumba Dalwanzo Lucy, and I come from Air Force Army Secondary School, and I'm going to present for you a poem. I hope you enjoy it. Hi, everyone. Oh, you look so beautiful in all your uniforms, but let me tell you something. Something that is itching me, so it's very itching, something I want to share with you. You see, in our society, where sectors grow, where innovations, where machines developed, there is an urgent need. There is an urgent need. I say there is an urgent need. I can hear the walls. I can hear the walls whisper stories of untold. I can see the streets paint scars of adolescents, who are stranded, triggered by the gun rippers, those who practice gender-based violence. Do you know gender-based violence? Oh, too bad you don't know. I expected someone to tell me. You see, gender-based violence affects us emotionally, not only emotionally, but physically, not physically only, but sexually. I'm telling you, gender-based violence can have a lot of impact. Let me tell you a story of this young girl called Mercy. You see, Mercy was just like all other girls, naive in mind. She could not comprehend what the world could bring to her plate. She could not understand what was lying outside there. She could not understand what is sex education. You know, there came a man, yes, a man, a hungry beast, who tried innocent, so cold. A girl so naive in mind, who could not comprehend, who was battered and scattered as if she was nothing. You see, this is a sad story, but it's not my story, but I want each and every one of us to think smarter, not dirty, to speak bolder, not slaggy, to walk the talk day together for the adolescents. Thank you.
Thank you so much. Can we give her another hand clap? Thank you. Let's have the Minister of Health from Nabingo. You're welcome, Evita.
Good morning, partners, fellow young people, and all the stakeholders present. My name is Nagawa Evita, the Health Minister, Trinity College Nabingo, as the co-founder of the Trikona Mental Health Club. And on behalf of the young people, I'm honored to stand before you today and strengthening multi-sectoral approaches to improve adolescent health and well-being. So last year, during the 2024 Adolescent and Youth Conference, there were strong commitments made. Today we are here to keep that promise alive.
Can we please have IT project? Okay, let's just give it a, it should be up shortly. Over to you.
So as we are reminded about our theme, strengthening multi-sectoral approaches to improve adolescent health and well-being. The commitments that were proposed last year in the 2024 Youth Conference are as follows. Government commitments: strengthen multi-sectoral policies and programs focusing on adolescent well-being, including mental health support, education, and reproductive health services. Development partners' commitments: continue to invest in adolescent well-being initiatives and support adolescent-friendly spaces. Community leaders' commitment: actively participate in addressing harmful practices and fostering positive cultural norms. Religious leaders' commitment: support adolescent well-being by creating platforms for youth-friendly dialogue within religious institutions, promoting moral guidance, and strengthening interfaith collaborations to address adolescent welfare. Young people's commitment: lead peer education initiatives, engage in community programs, advocate for youth-friendly services, and champion mental health support among fellow adolescents. So as the youth, we have expectations, and these are the following expectations. A collective call to action for all stakeholders to work together in breaking down barriers. Youth voices will be heard and valued in decision-making spaces, not as participants, but as partners. Building stronger communities for adolescent well-being. Creating multi-sectoral collaboration, open communication, and inclusive policies to ensure that every adolescent in Uganda has the opportunity to thrive. Stakeholders to renew their commitment to support adolescent and youth health. We, the young people, we are reminding the Ministry of Health, the Ministry of Education, our fellow young people, the community leaders, school administrations, our parents, that the voices of the young people still matter. Together, let's keep the commitment by turning them into consistent actions. Thank you for listening. I remain Nagawa Ivita, Health Minister, Trinity College, Nabingo.
Thank you so much, Nagawa Ivita. And who was your assistant? Please do introduce yourself so that we get to know you too.
Good afternoon, everyone. My name is Namugambo Olivia Tracy, the Deputy Health Minister, Senior 3.
Thank you very much, and thank you for presenting and supporting. We'll move on to Dr. Alan Kasozi, if we can have his presentation on, from the Adolescent and School Health Division. He's a Senior Medical Officer, to take us through the status around the Adolescent Health School Program 2024-2025. Over to you, Dr. Alan. Let's give Dr. Alan a minute. Please, can we have the presentation for Dr. Alan on? Thank you.
Good morning, ladies and gentlemen. Good morning, ladies and gentlemen. Now I can feel the energy. Ladies and gentlemen, my name is Alan Kasozi, and I work in the Division of Adolescent and School Health. I bring you greetings from the division and my colleagues who are seated amongst us. I'm here to present to you the status update on the National Adolescent and School Health Program, clearly indicating progress of how far we've gone as a national program, but also to answer the questions that the young person put to us. This presentation was put together by the division and most importantly, colleague Ramadan. We thank you for that. So, briefly, this is what we are going to talk about today. We're going to look at an overview of the status of the national program on adolescent and school health. The commitments have already been read, and then we'll look at what joint innovations are in place over the past year, progress status, looking at some selected indicators and how we are performing, challenges, lessons learned, recommendations, and then conclusions. Ladies and gentlemen, this is a general overview of what young people and adolescents are going through. And this slide basically means that young people are having sex, and they're having it way below they're supposed to be having sex, below the age. It is happening much earlier for girls than for the boys, usually at 17, and the boys at 18. But even in as much as they're having intercourse, they are not protecting themselves against all the effects, the negative effects that can happen after they've had sex. I'm sorry for the young people in the room, I will call it what it is. I'll call it what it is. And with this, we are seeing that we are stagnating. Teenage pregnancies are stagnating. The picture is not changing over the years. But not only teenage pregnancies, other poor health outcomes like increasing HIV infections amongst young people is also being noted on our end. We know that all this is grounded against events and circumstances beyond what young people can control. Poverty, gender inequality, and the persisting negative cultural norms. From what the young person has read, the previous speaker, Honorable, one of the commitments was from government side. And that commitment is the reason we are here today, which was to strengthen multi-sectoral collaboration, especially around policy formulation and programs focusing on adolescent well-being. I'll keep my comments only to what government committed. And allow me to give you some responses to those commitments. Policy formulation as the Division of Adolescent Health at the Ministry of Health, working hand in hand with partners and other key line ministries, Ministry of Education, Gender, Local Government. We've been able to come up with a document, which is the National Adolescent Health Costed Implementation Plan, which we hope to launch even today. This document has been drawn out of a broader document, a strategic document, which is the Reproductive Maternal Newborn Child, it's a mouthful, Adolescent and Healthy Aging Sharpened Plan. So it is expected that the National Adolescent Health Costed Implementation Plan will provide strategic focus, especially around strengthening leadership, multi-sectoral coordination, promoting an enabling environment, and increasing access and utilization of services by young people. We've also been able to strengthen schools' capacity to be able to identify disease outbreaks as and when they occur in a timely manner. And after this identification has been done, then they should be able to report to the Ministry of Education and Ministry of Health for timely response. This was occasioned by the need to protect our learners in schools, being that schools are high-risk areas, they are congregate settings, and disease outbreaks can easily affect our learners and easily transmissible. So this school-based surveillance is present in 17 epidemic-prone districts, and it was born out of a collaboration between Ministry of Education and Health. And just a quick look at it. That is how it looks like on the board behind me. It displays a dashboard. Once schools have done the screening for their learners and identified who needs treatment or who needs to be reported to higher levels of care, they are expected to be reporting on a weekly basis. And then districts, as well as key line ministries, are able to have a look at where the problem is. What is the most affected district, most affected age group, and all those other characteristics. We've also been able to come up with some guidance on how schools can work more closely with health facilities by developing some guidelines. The school health service standards have also been finalized, as well as a school feeding menu to standardize how learners should be fed in schools. Working closely with colleagues from Ministry of Gender and Education, we've been able to review guidelines on the provision of sexuality education. This was a direct response to some of our colleagues, especially the faith-based leaders who felt that this framework needed a bit of revision, and we have moved together along the journey of reviewing these guidelines. They are now called the National Framework on Education for Health and Life Skills, away from National Sexuality Education Framework, which was unfairly judged for enabling learners or young people to learn about sex. That wasn't the case. Working with Ministry of Gender and other key line ministries, we've been able to jointly disseminate the National Parenting Guidelines and Standards. Ladies and gentlemen, charity starts at home. And we can all agree that without the proper parenting skills, that's where everything goes wrong, especially for young people. So, these parenting guidelines and standards have been put in place, and we are jointly disseminating and implementing them. And at a subnational level in the districts, we have so far been able to roll out or establish district committees on adolescent health. Now, these committees enable your heads of department on education, on health, community leaders, gender, young people, religious leaders, parents, to come and sit together and discuss all issues adolescent health. They are directly under the supervision of the District Technical Planning Committee. And with your support, our dear partners, we've been able to spread to about 62 districts so far. So I believe that having said that, I've been able to answer the commitments that we made last year, which was around strengthening multi-sectoral collaborations for improved adolescent health and well-being. Now, ladies and gentlemen, without further ado, allow me to talk about an innovation that came up over the past year. And this innovation looks at preventing and reducing teenage pregnancies, as well as child marriages across the country. Because this seems to be one of the biggest problems afflicting our young people, especially the girls. And I'm going to be talking about teenage pregnancy surveillance and response platform. And as you can see from that pictorial in the background, and with the knowledge that it takes a village to raise a child, then you have to know that it is everyone's business to raise both boys and girls. So what is this teenage pregnancy surveillance and response platform? Basically, it is a mechanism, or call it an effort or an initiative that was established with the leadership of Ministry of Health, working closely with colleagues from the ministries I mentioned earlier: gender, education, local government, JLOS, to foster or to strengthen how we work together right from the national level all the way up to the grassroots. How we can work together to reduce teenage pregnancies. And so far, it is being piloted in Kamuli and Lamore. We are monitoring, continue learning and documenting the good practices that are happening there. But also we are implementing in about 31 high burden districts. High burden districts means these are districts whose teenage pregnancy rates are higher than the national average. The national average teenage pregnancy rate, maybe for the benefit of the young people here, I will tell you that for your colleagues between the ages of 15 to 19, 1 in 4 is already pregnant or has a baby. Can you imagine? Yeah. So, but we have districts where 1 in 3 of your colleagues is pregnant or close to that. So we're hoping that with your support, our dear partners, as well as Keyline Ministries, we can scale this teenage pregnancy surveillance and response framework. So basically what it looks at right at the targeted person, who is the teenager, and keeps graduating all the way in a series of its interventions all the way up to government level. So at the teenage on the extreme left, what do we look at? We look at, remember these discussions are happening at all levels, at national level, district, sub-county, all the way up to the community. So this framework looks at the events and circumstances, especially that increase the vulnerability of young people in getting pregnant. Is it that they are dropping out earlier? Is it that there is tokenism in the community, sugar daddies, and is it that whoever is defiling these teenagers is not being arrested? So all those vulnerabilities are examined, and there should be ideally a solution to that. And then the framework also looks at family, and around the families, we know that a family would ideally need also support to raise their children, livelihood support. They need capacity building. Fathers and mothers and aunties cannot give appropriate information to young people if they themselves they don't have it. Then community and cultural leaders, religious leaders, we look at what roles you're supposed to be playing and try to emphasize those roles. You are the custodians of some of these norms that are holding us, the young people, back. Child marriages, dissemination of age-appropriate information to young people, utilizing the special platforms that you hold in churches and communities. Speaking against some of these negative cultural norms, like female genital circumcision. Schools and out of schools, young people, we look at what roles schools can play, especially around tracking and responding to violence against children, enabling them to come back to school. Health facilities, are you providing friendly services to adolescents? Are your services timely? Are you reaching the adolescents who can't come to the health facilities? Are you non-judgmental and the like? Governments, what are we doing around policy development? Okay? But also providing services and bringing them closer to young people. And then academia, media, the fourth estate. We need evidence, as government, we need evidence to inform how we provide services for these young people. So that is, in short, the spectrum of the framework. That's how the framework is supposed to be working. But this and a lot more we will be sharing in the coming engagements after we've piloted and gotten to know how it works. So we also collect data. This framework seeks to account for each and every pregnant adolescent girl, as well as young fathers. So we collect data right from the community level, and this dashboard here shows you exactly how that data would appear like. So, having said all that, what are the districts actually doing? At the district level, we are encouraging districts, because this is where implementation takes place, to provide more youth-friendly health services, to provide group-based antenatal care for young mothers. This is one of the ways young mothers can feel comfortable. And it also helps them relate with each other and know that they are not alone. Post-abortion family planning services, mobile outreaches, talking compounds in schools, provision of life skills education, school debate competitions, and a lot more is happening. Child marriage rescues. So here we are, when I talk about child marriage rescues, is we are telling the districts that be intentional. Please, if you know that there is a young child in marriage, whether a boy or a girl, it is your responsibility to rescue them. You know, our society, we've normalized parents and perpetrators exchanging gifts. Once a girl is pregnant, then it is obvious that she should be married. But no, that shouldn't be the norm. They actually need rescuing. Ladies and gentlemen, allow me to take you through, next slide, how the National Adolescent and School Health Program has performed over the past year. And there is no better way to do this than to show you performance of some of the indicators on adolescent health. Who wouldn't freeze? So this slide shows us the proportion of outpatients department attendance by young people showing up at our health facilities, ages 10 to 19. You can see the bars on this graph. They are fairly constant in height, meaning that over the past 5 years, we are not increasing the number of young people walking through our health facilities, despite the fact that they form about 50% or more than, slightly more than 50% of our population. A lot more needs to be done to reach young people, especially where they're unable to walk through our doors. And here, allow me to show you, each bar on this graph has two colors. One color is it pink or peach? Oh, sorry. I think IT, we need to move on the same pace. Yeah, so in green, the green represents the number, absolute number of young males, boys coming to health facilities. And the pink, the pink represents the number of girls coming to our health facilities. And they are coming to consult about STIs, sexually transmitted infections. You can clearly see that the pink is more affected than the green. So we need a deeper conversation on why our girls are more or less 5 times more likely to have STIs more than our boys. And the complications thereafter. And then in the upper graph, we are seeing a percentage contribution of risk behavior by adolescents. The pink or the peach indicates percentage of alcohol use. So essentially, we are seeing a fairly constant trend that indicates about 1 in 10 of every person coming to our health facilities to get treated for alcohol use problems, they are young people, both boys and girls. But also, close to about 4% of all young people below the age of 19 have started smoking. And then we can also see an increasing trend by sheer numbers of young people attempting to commit suicide. From the period of July 2024 to July 2025, this year, we had about 454 attempted suicides by young people. That is quite a high number, and that is only the number that we capture at our health facilities. From my earlier presentation, the earlier slides, we noted that young people are having sexual intercourse. But even in as much as they're having sexual intercourse, they lack information on how they can protect themselves, and as such, they are getting pregnant and they are getting sexually transmitted infections. So one of the most effective ways we think that young people can avoid or can prevent pregnancy is through use of modern pregnancy prevention methods. However, we are seeing that the blue bar, it has also, the trend of use of modern pregnancy prevention methods has stayed fairly constant at around 20% of the new users, meaning that even in as much as young people are increasing in number, this proportion is not changing, and we need to find new ways of either expanding access and utilization to these methods, especially to young people who are in union or already married. And here we are seeing percentage of girls, pregnant girls, showing up for their first antenatal care visit. Okay? So amongst all the pregnant women coming for antenatal, their first antenatal care visit over the past 5 years, about 1 in 5 of them is a young girl below the age of 19. Okay? Ideally, these bars should be at 0, because young girls, or whoever is below the age of 19, is supposed to be at school. Not so. Now, this is an interesting slide. From our analytics at Ministry of Health, this is data. By the way, I'm presenting data from the DHIS2, which is the main data platform that we use at the Ministry of Health. So, over the past year, and for those of you that are going to be attending the National Safe Motherhood Conference starting tomorrow, you'll get to know that generally the number of births has increased, and that has not left out young people. Okay? So a lot more young people have given birth. Actually, as a country, I think we have about, over the past year, we had about close to more than 100,000 babies born beyond the usual average. And this also includes young people that have given birth. So this is what this graph is trying to tell us. However, in as much as we are seeing an increase in the number of births amongst young people, the trend in accessing services, antenatal care services, it has not changed. The proportions have remained the same, meaning that if you just go by proportions, for those of you that are doing programming, if you go by proportions, you know, teenage pregnancy proportions, rates, you may not get to the you might not get the true picture until you dig into the real numbers of these young people that are getting pregnant. And the trend, when we did the analysis, the trend is the same across all districts and regions that are implementing the teenage pregnancy surveillance and response framework. So like you can see on the left, the proportion of teenage pregnancies in districts in Acholi is fairly more or less the same year on year. So those are 2 years on the left, those are 2 years. Whereas on the right, when you dig into the actual numbers, even a 1% increment can correspond to a very, very big number. I can imagine if you had, I don't know whether we have anyone from Wachiso here. Yes. So if you had, if you had 5,000 pregnant girls, if in Wachiso, and you only got a 1% increment in that number, how many girls would actually be getting pregnant? That would be a huge number. By proportions, it sounds like it's a very small increment, but the number actually is what? Is big. I will not go through the analytics of all the regions because the trend is similar. Yeah. So, ladies and gentlemen, as I come to the tail end of this presentation, allow me to share with you some of the good practices that have come from this, from the implementation of the teenage pregnancy surveillance and response framework. The first one being that youth-friendly services are being delivered. Districts are getting support, and indeed they are delivering youth-friendly services. Youth-friendly services means that a package of adolescent-friendly services has been defined and is being delivered in a way that is private to adolescents, in a way that health workers are not judging adolescents, in a timely manner, meaning that adolescents are going to the health facilities and finding health workers there. They are finding also supplies, medical supplies, okay? And we have model districts that are implementing this. For example, like in Zombo, we've gotten to know, and Ajumani, we've gotten to know that with your support, implementing partners working together with the Ministry of Health, you have equipped adolescent-friendly spaces in health facilities with recreational materials. Recreational materials not only enable adolescents to have conversations, but also it can be an entry point for them to come to the health facilities. Board games, I can see behind there, I think Naguru Teenage Center, they've invited some board games as well as some other partners. They'll be telling us how exactly the board game works. And also YAM is implementing these youth-friendly services. Parenting and family strengthening, as we disseminate jointly with Ministry of Gender, the parenting guidelines and standards, we are increasingly seeing partners taking up this campaign, especially in training, building the capacity of parents, and building peer networks amongst parents and young people, young parents, to improve their parenting skills. Data-driven learning systems. At the Ministry of Health, we usually have a weekly meeting every Friday morning, and I would invite each and every one of you to participate in this meeting where we discuss teenage pregnancy, surveillance and response in a number of selected districts. Every teenage pregnancy should ideally be accounted for. Then we are also engaging cultural institutions and leaders. If we have anyone from Busoga here, you can put up your hand. Thank you, including our chief guest. Yes, so Busoga has clearly shown that they are quite intentional on reducing teenage pregnancies, and actually the king, the Chabazinga of Busoga, has taken on the mantle to become the cultural ambassador against teenage pregnancy in this country, and for that we thank him. And then we also have male engagement and community accountability mechanisms. Ministry of Gender is taking lead on this, and they have a number of initiatives, including an initiative called Real Fathers, where they are building the capacity of young fathers to reduce intimate partner violence, raise children in enabling environments, as well as improve their parenting skills, basically. So when it comes to challenges and some of the solutions that have been suggested, as we have been implementing, we have found that there are still some health worker shortages, but this has been, with the integration agenda, you know, since the funding cuts following the executive order, as a country we are learning that integration is the way to move forward, and every single shilling or dollar has to have maximum impact. So we are task sharing under this integration agenda. Just recently we passed out community health extension workers, they choose, and these people are doing a wonderful job where health workers are unable to reach. Then, of course, inadequate and unsustainable funding, which we are dealing with through integration. We have geographical and infrastructural barriers, but we are also increasingly using digital models to reach young people. Young people, have you heard of the Ministry of Health helpline? It is freely available online. It is a toll-free number that you can always call anytime you need information, and there will be a counselor at hand to talk to you, even if it's counseling, or if you want to be referred for a service, free of charge. You don't have to have airtime. We still continue to see some commodity stockouts, especially on the demand side, and health facilities need support in especially how they can quantify and project their commodity needs. Incomplete and inconsistent data, capacity building still is needed. We also still have persistent beliefs, especially cultural beliefs, and it's the reason why some of the negative practices persist, like female genital mutilation in Western Uganda. Is it? Oh, I'm lying. Female genital mutilation, child marriages. Okay. But also, we have learned some lessons as we implement this teenage pregnancy and surveillance and response framework. We have learned that multi-sectoral coordination is essential. It is essential to work together, but it is not enough. A lot more needs to be put in. We have a number, those of you from the district local governments, we have a number of mechanisms, committees. Districts are not short of committees, but the committees are not sitting. They would love to sit, but they are not doing what? They are not sitting. They need a bit of support from partners to sit. We have the DICA. I will make a case for the DICAs. Sorry, my computer's blacked out here. I would make a case for the DICAs. DICAs need a lot of your support, partners. DICAs are district committees on adolescent health. They bring together young people, religious leaders, community leaders, to come and sit and discuss, actively participate in issues that affect them. But they would need your support, especially in attending some of these meetings. Mr. MC, allow me to hold my microphone like this. I don't know. Next slide. Okay, so those are the lessons learned. We've also learned that peer-based approaches for both young people and older people are more suitable. It is easier for people to listen to their peers, people similar in either education or age, okay? And all that is needed is to build the capacity so that appropriate information is passed across. Young people always tell us they fear older health workers or older VHTs. Male engagement and parenting is very essential. The family is the most basic unit of governance and unit of social cohesion in our society. So parents need that capacity to know how to raise their children Education, our colleagues from the Ministry of Education, we thank you for being flexible enough to allow previously pregnant girls and parenting girls to return to school. Religious and cultural institutions are low-hanging fruits. We recognize your contribution in reducing teenage pregnancies across the country, and I think we agree that we need to engage more. Reverend Everett, you will agree with me on that. As well as we need to continue using data to inform our decisions. Next. So some recommendations have also come through the districts that are implementing this teenage pregnancy surveillance and response framework, including that school-based teenage pregnancy and surveillance infrastructure prevention of pregnancies can best be done, especially in schools and communities. If schools are empowered with information, then they can easily pass on this information to young people. Given that young people are spending close to about 75% of their time at school, that would be one of the best platforms to meet them and pass on these messages. Then we also need to increase community-led engagements by expanding parental group networks, especially male parents. Then we also need to increase life skills education. We need to fast track. A framework has been developed, but now what remains to be seen is how the key line ministries cascade these life skills to the intended users for learners both in and out of school. Male engagement needs to be taken more seriously, but also we need to start having a conversation on what is holding us back. And we know what is holding us back: persistent negative social cultural norms. We must tackle them. Next. So in conclusion, when we talk about teenage pregnancy, maybe it might sound abstract, but to put it in simple terms, over the past 5 years, we've been having about 300, close to about an average of 360,000 deliveries by young mothers below the age of 19. Ladies and gentlemen, 360,000 young mothers delivering in a year translates to 1,000 girls getting pregnant every day. Yeah? 1,000 girls getting pregnant every day. And of course, with pregnancy, sometimes comes forced marriages. Okay? So as we conclude, let me just read it verbatim, that Uganda's teenage pregnancy and child marriage crisis, that is about 1,000 girls becoming pregnant every day, and some of them getting married off before the age of 18, it represents a profound threat to the human capital development and national transformation aspirations. Teenage pregnancy will keep young girls and boys in a cycle of poverty. They will not finish education, and if they don't finish education, they will not be employable, and if they're not employable, it makes for a very bad reading for our economy. And we also, rather than building roads, we'll be spending more money to treat the complications of abortions, because when they're pregnant, the pregnancies are usually not intended, they will abort sometimes, as well as the deaths and potential losses that we'll lose when our young children die. And the pathway forward is clear. We possess the Teenage Pregnancy Surveillance Response Framework. We possess the recently revised National Framework on Education for Health and the Life Skills. We have parenting guidelines. Ladies and gentlemen, we are not short of all these beautiful frameworks, okay? And we also have the political will. The First Lady is a champion of the girl child, and she's also a champion against teenage pregnancy. So then, the question begs, what remains? What remains for us to do is a systematic implementation at scale all across the country of this teenage pregnancy surveillance and response framework. With all the beautiful interventions that I read earlier on. Next. Yes, so that brings me to the end of the presentation. Ladies and gentlemen, thank you for listening to me. I thank colleagues from the Division of Adolescent Health, and especially Ramadan, for having come up with this beautiful presentation and for your attention. Thank you very much.
Thank you. Thank you very much, Dr. Alan, for taking us through that information that should annoy most of us so that we are to act. Can we now stand up for the anthem? Our chief guest is already here. Can we have the national anthem, one stanza, followed by the East African community, one stanza. We can take our seats. Our chief guest, the Permanent Secretary, Minister of Gender, Labor and Social Development. I would like to take this opportunity to welcome you to the Adolescent and Youth Conference under the theme, Strengthening Multi-sectoral Approaches to Improve Adolescent Health and Wellbeing. Before you, our chief guest, Permanent Secretary, and also in the presence of the UNFPA country representative, we have development partners, we have senior government officials from Ministry of Health, Ministry of Education and Sports, Ministry of Gender and Social Development, National Planning Authority, Ministry of Local Government, and District Local Governments present here. Chief guest, we want to thank you for having found time to come and join us at this very important pre-event activity. The presentation you found was giving us an analysis of where we are. And that is mind-boggling. Mind-boggling, it is meant to make all of us annoyed to be able to act. We have a lot to work on, a lot to change. A lot has been done, but a lot remains undone. May you allow me, our chief guest, to invite Dr. Openitho, Commissioner, Community Health, Minister of Health, to come and make a few remarks and officially recognize your presence here before I invite the young people with a skit to give us a skit. Dr. Okay, Openitho is missing in action, and I'm deploying police to look for him. And as we do that, allow me to invite the young people with a skit. The skit. Let's take out very quickly. We have time.
Hey, people.
That's a good one.
What's wrong with you guys? Come. Mama Nansha, you leave the food.
Oh, hey, people, finally you've arrived. I thought people are still digging. Hey, you're tired? Hey, it's okay. Don't worry. Hey, Odom.
Have you come to get food?
Don't worry. You can settle.
Let me hope you're not requesting for votes.
It's okay. We shall know why we are here. Are we together? Hey, cultural leader, you've come. Yeah, I thought you man you're not going to come. You know, you're very difficult to get. Eh? So basically, we are here to know what Naguru Teenage Center does and the roles of Naguru Teenage Center. How many of you have ever heard of it?
What is Naguru Teenage Center?
Hey, we even have some peer educators within you. Hey, like that girl. Eh? We work with her in Moyo. Hey, you didn't know? Hey, she'll tell you more. So basically, my name is Wabusake. It's not about Museveni. Hey, I know we are in campaign times, but for us, we work in health. Basically, I spent 30 plus years working with young people.
Hey,
you remember the other time? Remember the other time when we had some young people dancing, giving out materials?
Are you the people who are supplying condoms?
We are the ones. So we work with leaders and your youth leaders, the cultural leaders, to talk to you people about your health. We are doing advocacy. We are going to schools and talk about health. We are doing this for 30 plus years. Don't you think you guys will deserve a clap? And by the way, we are not working alone. We are working hand in hand with the Ministry of Health and other partners. We have UNFPA, we have UNICEF, and other partners who help us to do this work. Are we together? So, right, I know you people are from the garden, but you'll forgive us. So we shall have the youth stay behind and have a youth club. They have issues they need to talk about.
I hope you have not come to get that and you just go and stay with it. You fit in your report. You want something which is continuous, not a short-term intervention, but a long-term intervention. Thank you.
It's okay. As you all know, we want to do things that you guys can sustain. Pull out. We don't want it to collapse. You need to continue doing these things to support the young people.
Okay.
Yeah, thank you for listening to me. So we shall have the young people stay behind for their meeting. Who is the youth leader?
Hey guys, thank you for coming for the meeting. You're all welcome. Yes, I'm here. Hi Sharon. Long time too. No, what happened to her? How did it happen? Disco Matanga? How old Nancy? How old is her pregnancy? Has she begun going to neuro services? Yes, it does.
You're still talking about Sharon. I survived of everything.
Did you get the necessary help you're supposed to get? Yes. From? Okay. Yes, that one. Okay, the youth corner is going to be up. So guys, thank you for airing out your challenges. I'm going to sit with my technical team and we get the solution. Thank you. I will.
Oh, you are most welcome, our dear visitors. This is Chikwata Henry, a youth representative at the district. Our dear DCDO, OC police station, you are most welcome. I'm seeing the school, also the in-charges around. You are most welcome. As you heard that we invited you. We had a meeting as younger people, and we had issues that are affecting younger people in our communities. And since you are the stakeholders, we know that you can help us to tackle into these problems. Allow me to invite my comrade, the youth chairperson of this sub-county, to say that he can present the issues to you, and you hear our concerns. You are most welcome, my comrade.
Good afternoon, ladies and gentlemen. Thank you for honoring this meeting. Having had a meeting with my fellow youth, I present to you the challenges we are facing in our community. I'm called Ajamu Patience Olombe from Namaingo district, and these are some of the challenges we are facing as youths. We are facing teenage pregnancy due to lack of the right information on how to prevent it, and also school dropout. Another challenge we are facing is female genital mutilation due to the cultural practices still going on. And another challenge is absence of the condoms in the condom dispensers due to of the youth-friendly corners. Thank you. I hope you are going to get the solutions for it.
Thank you, my comrade. After having heard from my comrade, allow me to invite the OC police station. You have heard and come in and you response.
Thank you, dear members. The protocol remain observed. I'm Manizati Robert, the OC. I think me and my team, we need to work hand in hand. You know, the police cannot work alone. I need to liaise with the Child Protection Committee, parents, and the CDO. Anybody involved or indulged in FGM, we have him arrested and deal with him accordingly. Back to stop here. Thank you.
Thank you, Mr. Ossi. Allow me to invite the representative from the school to come and say a word to us. As younger people, we are eager to hear from you.
Thank you. I'm Madam Lopez from Bulopa Secondary School. Yeah, as she said, the issues they are facing. For us in schools, we will incorporate health education programs so that these students get to know more information about health. Yeah, the issue of school dropout and pregnancy, with the help of the Global Teenage Team, we'll train some of the students so that they give more information to other students about health.
Thank you, madam. Allow me to invite the CDO to say a word to us. You are most welcome, sir.
Thank you, moderator. Young people, all dignitaries around. I'm by the name Simon, the CDO. I would just love to appreciate the young people for advocacy to be done within the communities. And still, I will have to thank Nagulu Teenage Center that has given you that capacity of advocacy that now you can raise up your issues by yourselves. All I can do as a CDO or a local government official is to commit that I will have to make sure that your issues are heard to various offices, working hand in hand with all the community-based organizations we are working in, fronted by Inaugural Teenage Center. I beg to submit.
Oh, thank you, Mr. So, after hearing from all those, allow me to invite the in charge. You also give us the closing remarks. All issues were in your office. Thank you.
Thank you so much, moderator. By names, I'm called Okoi Sam. I'm the facility in charge. I would like to begin by appreciating the fact that the numbers of teenage pregnancies
to say that these issues. Thank
You're welcome, colleagues. It has been long, 6 months already down the road. I addressed well.
Truly, most of the challenges were addressed. One of the corners, and I managed to get the family planning services.
I'm so happy that they were able to address our challenges and they got solutions for us. Another one who got the solution for them.
Is still giving us headache. GM is still continuing illegally.
So much. So that was our play. We're trying to highlight and how the CBOs have come into play and our part so much.
Clean information is now reaching more youth. Thank you so much.
Can we clap for the children? These are children under Naguru Teenage Peer Club from different districts of Lamingo and others. And their message is clear. And their action now. When you hear 1,000 children getting pregnant and 34% of our children being, we have all reason to get worried. But worrying alone, act now. If not now, when? If not through partnership, then how? Our chief guest, before I invite the representative UNFPA, allow me Irene to speak about what you are about to launch. You will be launching the costed implementation. And so I invite UNFPA country rep. I would like to invite Commissioner from Ministry of Health. This is going to launch. Commissioner Irene. But you can afford. Yes, you had breakfast, so you want me to get ashamed.
Yes, thank you very much. Our chief guest, the Permanent Secretary, Ministry of Labour and Social Development, representative, the representative for the National Planning Authority, colleagues from the Ministries of Education, Ministry of Gender, local government, and police, implementing partners, Uganda, our young people, all our distinguished guests, good afternoon. Pleasure to share what we are going to launch, and this is the costed implementation of adolescent. It is a multi-sectoral plan that has been developed manner. I have just a few slides to share. But the National Adolescent Health Costed Plan runs for 5 years, that is 2026 to 2020 to 30. It's aligned with the national development. Next slide. I'll not go into the statistics. I have mentioned its alignment plan and other line ministry documents. Plan national framework on health and the national strategy to end teenage pregnancy and child marriage, and a number of other documents that are aligned to this costed implementation plan. The CIP, we know that the adolescents and young people have heterogeneous, and this CIP addresses the common challenges. We've listened into the statistics, we've listened into issues of sexuality, we've listened into the problems around substance abuse, malnutrition, rising HIV infection. The CIP will serve as a document to holders, in the implementation, and support programs, monitoring of progress over the years. I will not dwell on this. Global plans, including the Ministry of Health strategic plan. So the process was consultative, as you can see, and it drew
that this will also include the annual report on multi-sectoral efforts, so that teenage pregnancy, surveillance and response. All these will be launched by you, our chief guest. Our chief guest, allow me now to invite the UNFPA country representative to Uganda, Christine Brokers. This is her first public engagement since she reported to her new station, which is Kampala. She has worked before in West Africa, but this is her first time in East Africa. Can you join me in welcoming our new country rep to make a statement? Thank you so much, Christine, for being here, and you are welcome to the Power of Africa.
Thank you so much. Permanent secretaries from the Ministry of Health and from the Ministry of Gender, Labour and Social Development, Mr. Angre. Distinguished leaders, partners and colleagues from government ministries, departments and agencies, civil society organizations represented here today, religious and cultural leaders, acknowledging the King of Sebe and the Uganda Kingdom represented here today, district representatives, colleagues from the media, and of course, most of all, our brilliant adolescents and young people who are here today. It's very nice to be here. It's an honor for me to stand here. I'm new. I've just arrived in Uganda as UNFPA representative, but I'm not only standing here as a UNFPA representative, I'm also standing here as a very firm believer in the power of this generation. My commitment is very simple. I would like, along with you, to see every young person in Uganda not just survive, but to thrive and to realize their full, incredible potential. We are all here today because we have some work to do. We need to make some changes. We know, I have to put my glasses on. I'm not as youthful as all of you. We're here today because we need to consider the data. There's too many dreams that are being interrupted. Adolescents aged 15 to 19. Can you raise your hand if you're between 15 and 19? You represent 12% of the population. Can you raise your hand if you're between 18 and 30? It's a lot of you, which is representative because you are 23% of the population. Now, you together represent the youth bulge that Uganda has, which represents amazing opportunities for this country, but also we have to acknowledge certain challenges that we need to face together. 24% of girls who are between 15 and 19 have already started childbearing. 33% of women between 20 and 24 years old were married before the age of 18. And there's no other way to look at it. It's a violation of their human rights, and we cannot accept it. In Sebe and Karamoja regions, FGM continues to create health complications and prevents girls from accessing education. Now, of course, these are health issues, but they're not only health issues. Your well-being is a developmental, educational, and economic priority for this nation. Uganda is on a remarkable development journey. And so to continue that amazing progress, all of society is needed. So this is a call to arms. You all, adolescents and young people, you are the architects of the change that needs to happen. How Uganda continues to develop, the quality of the solutions that you design will depend entirely on your active engagement. And of course, your engagement depends on how well your society is able to equip you and invest in you. All of society has to be involved. From the Ministry of Education, we need schools that are safe to go to. We need quality sexuality education that is evidence-based, that empowers young people and gives them information that is useful and accurate. From the Ministry of Gender, we need skilled upskilling and livelihood programs that means that every young person has economic power and agency. From community, cultural, and religious leaders, we need support to actively dismantle harmful social norms and to protect girls from gender-based violence and from child marriage. At UNFPA, we pledge our support to continue our partnership with the government of Uganda and with all of the other strategic partners to deliver for adolescents and young people in Uganda. For example, with the Ministry of Health, we are working on vital innovations like the Teenage Pregnancy Surveillance and Response Platform and in rolling out the Adolescent Health Quality of Care Standards. These are tools that will help us to take the data, analyze the data, understand how to use the data to ensure dignified care. And to you, our young leaders, I have a message. Actually, it says here that I'm supposed to tell you to use your voices. And from just being here for a couple of hours, I can see that you don't need any encouragement. I can see that you are going to use your voices. So we would like to support you in that. UNFPA is committed to continuing to support and to continue to engage with youth-led organizations and structures and to invest in meaningful empowerment. As you move into your track sessions this afternoon, I would encourage you on two different tracks. One is demand investment. Don't wait for it. Invest in your health, education, and economic inclusion is the single smartest investment that Uganda can make to reap the benefits of the demographic difference. We have to translate today into sustained budgets at both the national and district levels. You need to hold your leaders accountable. And secondly, we count on you to lead the change. We must actively fund and elevate youth-led and youth-serving organizations. Your peer-to-peer initiatives and your digital health innovations are the most powerful accelerators we have. And those are not just words, by the way. We have actual evaluations showing us that your peer education initiatives are some of the most effective things that we have to actually make change. I think you know it very well because you see the results on the ground. So to conclude, the energy and passion in this room is undeniable.
Goes to you, the CEO of Ministry of Gender, Labor and Social Development, the man who writes my paycheck. This is Mr. Agre David Chibenge. He has
showing us that your peer education initiatives are some of the most effective things that we have to actually make change. I think you know it very well because you see the results on the ground. So to conclude, the energy and passion in this room is undeniable. This work is not easy work, it's hard work. But together, government, with partners, and especially with adolescents and youth, we can achieve a future where every adolescent is healthy, empowered, and safe. A world where every young person realizes their potential. And to do that, we need to invest in you and to put you first. Remember that you are never too young to make a difference. Thank you so much.
Thank you. Thank you very much, UNFPA country representative. Not only survive, but thrive. We thank you. And we want to welcome you to the Republic of Uganda, and we commit to cooperating and collaborating with you. I now have the rare and singular honor to introduce the CEO of Ministry of Gender, Labor and Social Development, the man who writes my paycheck. This is Mr. Agre David Chibenge. He is a veteran and accomplished public administrator. He has worked before in the Ministry of Education and Sports, where he spent a lot of years. He has worked with the Office of the Prime Minister, among others. He is also a former youth leader, an accomplished youth leader. He is a good fan of football. And if you want to know, he's formerly a referee. He supports Uganda Cranes and another team which is not on good terms with Arsenal. I will not mention that one.
Request that we stand up, all of us, and observe a minute of silence.
Among so many other things. Mr. Agre David Chibenge, you are welcome to us, and thereafter do the launching of the different documents. I thank you for finding time to be here.
You should have added that the team he supports won an important game over the weekend. But all of you colleagues from government ministries, departments, agencies, the district, local governments, representatives of our development partners, civil society organizations, the UN agencies, and in a very special way, I would like to welcome Christine, the new UNFPA representative to Uganda, the representatives of cultural institutions, adolescents, the youth leaders and advocates. I want to thank the team from Naguru Teenage Center Peer Club that shared an important message with us today, and all of you distinguished ladies and gentlemen. But I wanted to start with a request that we stand up, all of us, and observe a minute of silence in memory of a colleague, a gala against teenage pregnancies, early marriages, sexual and gender-based violence, violence against children, a relentless promoter of adolescent health, reproductive health, the late Agnes Sebroa. We'll observe a minute of silence in honor of Agnes, who was working of health. May she rest in peace. It is a great honor for me to join you at this important National Adolescent and Youth Pre-event on safe motherhood. And allow me to commend the organizers, particularly the Ministry of Health, together with my team from the Ministry of Gender, Labor and Social Development, UNFPA, UNICEF, World Health Organization, and the various institutions that are represented here, as well as the various youth networks, for convening this dialogue, which is focused on strengthening multi-sectoral approaches to improved adolescent health and well-being. You have already been informed that Uganda has one of the youngest populations in the world. It is said ours is the second youngest in the world, with over 75% of our citizens below the age of 30, and nearly 1 in every 4 Ugandans is an adolescent between 10 to 19 years. This demographic structure presents immense opportunities, as you've heard from the UNFPA representative, but also significant challenges if their health, education, protection, and livelihood needs are not adequately addressed. Adolescence is a critical period of transition, a time when physical, emotional, and social foundations are laid for adulthood. Yet, it is also a period of heightened vulnerability. When I look back at my own journey, I consider myself lucky because at the age of many of these young people, I could have made a wrong turn in life. And maybe I would not be here. So adolescence is a very difficult period to navigate for our young people, for families, and that's why it is important that at all times we keep our eyes on our young people as a country. Current data, and this has been shared from the Uganda Demographic and Health Survey of 2022, reveals that, and the presenter I found when I walked in did indicate that 24% adolescent girls aged 15 to 19, in the case of Uganda, have unfortunately begun childbearing. You can imagine a child of 15 producing another child that she or he has to look after. And when Dr. Mugendawala here from National Planning Authority, I'm sure, makes his presentation, he'll underscore the risk that we run as a country with a huge population, with a young population, where the majority of them are mothers who still need to be cared for. Children producing children. And in the case of Uganda, I think that is a very big risk. Much of what we see today is a result of the kind of population we have as a country. Easily excitable, easily distracted from the key messages and key issues, and all many of our young people do is to swell ranks of people who will easily excite them. And as a country, I think that is dangerous. But also teenage pregnancy, the teenage pregnancy rate of 24% remains one of the highest in sub-Saharan Africa. And you've also heard that 34% are married off before 18 years of age. Adolescent maternal mortality contributes significantly to overall maternal deaths, while HIV prevalence among young people aged 15 to 24 years, and particularly girls and young women, remains disproportionately high, driven by gender inequality, violence, and limited access to information and services. Understandably, the high rates of GBV we are fighting or grappling with as a country is simply because what would you expect of a young married wife of 15, 16 years of age in terms of responsibilities in a home? But many of our young people, forced out of school, forced out of their homes, to go and start their own homes prematurely, and they ultimately end up as victims of gender-based violence because the expectations are unfairly too high in terms of how these young people can manage their homes. But there are also increasing cases of mental health challenges, substance abuse, and online sexual exploitation, which further threaten adolescent well-being. These challenges are interlinked. They are shaped not only by existing service delivery gaps, but also, as you've again heard, social norms, poverty, weak family and parental support, and limited livelihood opportunities. It is therefore evident that no single ministry can address adolescent health in isolation. Adolescent well-being demands a whole of government approach as well as a whole of society approach. This ensures that interventions across health, education, protection or social protection, social development, and economic empowerment are complementary and not fragmented. We are already working on this. He called me a CEO of the Ministry of Gender, Labor and Social Development, but we have been engaging with my colleagues, the PS of Ministry of Health, the PS of Ministry of Education and Sports, the PS of Ministry of Local Government, the PS in charge of the Health Service Commission. We have been engaging of late, and we have come up with an intervention where we are going to work towards strengthening social services committees, right from grassroots level up to, with a view that we get all the key players together at every level, from education, from health, from gender, the community development officers, the social probation, welfare officers, the health workers, the DEOs, all of them working together at different levels to make sure that we have an integrated response to the issues of young people and improved service delivery. The health sector, for example, ensures access to quality, adolescent-friendly reproductive health services and mental health care, while the education sector keeps girls and boys in school and provides sexuality education. The social development sector addresses issues of harmful norms, working with the cultural institutions, as you've heard, gender-based violence, livelihoods, and social protection needs. Governance and security or access to administration of justice or programs under Ministry of Justice and Constitutional Affairs, the Ministry of Internal Affairs, all of them ensure that laws protecting children and adolescents are enforced. The government system provides the coordination framework at community level. It is these interlinkages that are also at the heart of our national priorities under the 4th National Development Plan, NDP4, which identifies human capital development as the driver of socio-economic transformation. There are a number of policies, I'm sure these have been outlined here, including the National Adolescent Health Policy of 2017, and we are now moving into the National Adolescent Health Costed Implementation Plan, which we are going to launch this morning or afternoon. We have the National Child Policy under Ministry of Gender. There is the Education Plus initiative, First Lady and Minister of Education and Sports, which is aimed at ensuring that every girl or young woman in Uganda completes secondary education. There is the youth under the Ministry of Gender, Labor and Social Development. You've heard about the youth, the Uganda Women Entrepreneurship Program. You've heard about PDM, the Parish Development Model. You've heard about the National Strategy to End Teenage Pregnancy and Child Marriage, which provides a coordinated roadmap for action across sectors and stakeholders, and a number These frameworks reflect Uganda's commitment to African Union's Agenda 2030, the Agenda 2063, 20 development goals, and Agenda 2063 for the African Union, and our obligations under the Convention on the Rights of the Child and the African Charter on the Rights and Welfare of the Child. The Ministry of Gender, Labor and Social Development serves as the national coordination hub for child and adolescent development, and through our Department of Youth and Children Affairs, we work to ensure that policies and programs across sectors integrate adolescent needs. I would like to appreciate the UN family because we are currently implementing the United Nations Joint Adolescent and Youth Program in partnership with 13 UN agencies to strengthen systems for adolescent empowerment, livelihood, and education. Also lead national efforts to improve adolescent participation in decision-making processes at all levels, end teenage pregnancy, and promote gender-responsive parenting. In collaboration with local governments and community structures, the ministry supports child protection, coordination structures, service, workforce development, and life skills programs that enhance resilience and agency amongst young people. Despite progress, there are quite a number of gaps that require urgent attention, one of which is coordination and accountability between sectors and levels of government, and we've said that we are working on this. Issues of data and evidence on adolescent health outcomes, particularly for boys, out-of-school youth, and those in humanitarian settings, has not been readily available. Financing for adolescent health and youth development within national and local government budgets is not sufficient to enable us to do everything that we plan to do. Persistent social and cultural barriers, including stigma, gender stereotypes, and weak community engagement is another, as well as poor individual adolescents and young people, which require that we continuously engage with the young people. But strengthening multi-sectoral approaches entails the following, and I'll just quickly outline this. One, establishing functional interministerial coordination mechanisms with clearly defined mandates anchored in our various policy frameworks and replicated through the district and sub-county multi-sectoral committees for coherent policy implementation and accountability. And I've said this has largely been achieved. We have a national interministerial child well-being committee. We have national teenage pregnancy surveillance platform and several others that have been shared. The other is embedding adolescent responsive priorities and indicators within the sectoral plans and the medium-term expenditure frameworks so that we can have budgets targeted at financing arrangements to address issues of the young people. Operationalizing an integrated national adolescent health information platform that consolidates data from health, education, and social protection sectors to enable evidence-based decision-making. Developing a harmonized capacity building framework for frontline workers across the sectors that I've mentioned. Institutionalizing structured youth participation in policy and program design, monitoring, and evaluation. we commit as a ministry to strengthen the youth structures that facilitate their participation right from the youth councils in every village, parish, up to district level and national level in this country. There are youth councils. In the schools, as Mr. Mondo said, I was a youth and a student leader myself. I grew up in the Uganda National Students' Association leadership while I was still at school, and I know that even in the schools, there are structures that facilitate participation of young people in decision making and even policy making. Integrating interventions that tackle underlying drivers of poor adolescent outcomes, including poverty, the harmful gender norms, school dropout, and violence through community-based parenting, social protection, and re-entry frameworks, as you've heard. A lot of emphasis is being put by government and our ministry on youth economic empowerment through the various programs of government that I've enumerated, as well as skilling and purposeful engagement of young people. And then positioning families and communities as the first layer of accountability within the national coordination framework. Ladies and gentlemen, I'm one of those people who believes strongly that before we even look to the schools, we should first get it right at family level, because that's where I think the fight is being lost, at family level. That care less for their children will not give you the adult that you would like to see. So we need to work with the parents and people that they tend to expect that schools will do much more than they should be in the homes. And that's why during the COVID lockdowns, we had a lot of issues in terms of parental care and responsibility. And that's when we lost almost the fight against early marriages, against teenage pregnancies, because parents have absconded from their responsibilities. So the fight against teenage pregnancies, early marriages must start at that level within the family. There should be limitless love extended to our and engagement with our children. Those parents that do it have better results than parents that don't do it. And I know I'm talking to a number of adults even within this room. Don't delegate the responsibility of upbringing to only the mothers of these children, to the relatives of these children. It is our responsibility, all of us. Safe motherhood, on the other hand, also begins long conception. It begins with enabling girls to stay in school, to delay pregnancy, and to access quality health services. It begins with strengthening families and community adolescents' potential and protect them from harm. Let us remember, ladies and gentlemen, that adolescent health is not a medical issue, it is a development imperative. It affects our productivity, it affects education outcomes, and the very sustainability of our nation. And the Ministry of Gender, Labor and Social Development therefore calls upon all stakeholders, including government agencies, civil society organizations, the faith-based organizations, the cultural institutions, academia, and the private sector to rally behind a shared agenda for adolescent health and well-being. The number of indicators under NDP4, in the interest of time, I'll not read this. I know a number of them have been covered. But we need to align our efforts towards attaining our NDP4 results. NDP4 is the overarching agenda of this government for transitioning our country to the middle income status, if you want. And we must do it with this resource that we have of our young people. In conclusion, ladies and gentlemen, let us affirm our commitment to a Uganda where every adolescent, girl or boy, rural or urban, refugee or national, has the opportunity. As the late Kofi Annan once reminded us, no society can afford to neglect the potential of its young people. Not only our future, they are our present. Together, let us sectoral approaches that transform this potential into progress and this promise into prosperity. And lastly, to you, our young people, as I look at you today, I see the heartbeat of Uganda, a generation full of promise, courage, and ideas. You are not just the future, you are the strength and the spirit of our nation today. Each of you carries a light, a spark of resilience and creativity that no challenge can extinguish. Use that light to shape your destiny, lift your peers. You've heard about the peer clubs and interventions in that, and to build a Uganda where every girl dreams without fear and every boy stands for respect and equality. Your health, treasure your education, and believe that your voice has power. Yes, because it does. Never let anyone convince you that you are too young or too small to make a difference. Real change begins when you dare to dream and act with purpose. And please keep focused. When I was at your age, I used to see people get distracted. As you are walking home, some young man or a boda rider comes to you and tells you how he loves you so much. When did he start? He's just found you on your way home. And he's convincing you that he loves you so much. So just keep focused and don't allow any distractions. Government can and will opportunities for you, but the real transformation starts with you. So rise with confidence, lead with compassion, and remember the future Uganda we all dream of requires you to be healthy, to be skilled, to be productive, because the nation's strength is built on the potential of its young people. I thank you for your kind attention, and Minister of the Health actually inviting me to come and talk to these young people, and I do this for God and my country.
Afford to clap better than that. I want to thank you, Permanent Secretary, Minister of Gender, Labor, and Social Development. Do not complain about darkness, light the. You are not too young to make a difference. It's the difference we want from each one of you. Yes, I normally tell people that the best revolution that I know of started his revolution at the age of 12. And if you are below the age of 12, put up your hand for recognition. I don't see any. And that was Jesus Christ. At 12 years, he was found in the synagogues, teachers the law, and then that's when he started the revolution. And all of you who are Christian, every morning, every afternoon, every evening, including Canon Reverend Everett Mugarura, you kneel down in recognition of these revolutionaries. Now, Mr. P.S., I want to request for one more thing. There are these documents you are going to launch. Can I request the following people to accompany you? The UNFPA Country Rep, Commissioner Youth and Children Affairs, National Planning Authority, academia. I'm seated with two professors here who have been so central to do as far as concerned. Uganda Cultural Institution, Sebei Cultural Institution, Ministry of Internal Affairs, represented by Maureen Adhaire, Ministry of Health, I don't know whether the DG has arrived, the Director General of Health Services, Minister of Education and Sports, Minister of Justice and Constitutional Affairs, one religious leader, two children, one girl and another boy, and one representative of civil society organizations. Can my team lead the permanent secretary to come and the needful? Amon, are you there? Yes, so the PS will be the first one to do the signing, followed by the UNFPA country rep, and then the rest of the people whose titles or names I've mentioned, you'll follow suit. And so if I were you, I would start lining up so that we execute. This is the moment. This is the moment, and these are the documents that will be guiding us.
A celebration to last throughout the years. So bring your good times and your laughter too. We gon' celebrate your party with you. Come on now. Celebration. Let's all celebrate and have a good time. Celebration. We gon' celebrate and have a good time. It's time.
Let's now do the photo moment before the PS looks at the exhibition, before it can leisure. So we shall do a photo opportunity with the permanent secretary, who is our chief guest, and the men on the cameras. You'll guide us on how to do that, because we need evidence that this happened. I can also see the beauty queens around here. Beauty with a purpose. Yes. Now, Amon, come and guide us on the photo. I'm not very good at things to do with photography, so you have to hand over peacefully to the authorities in this area.
Thank you so much,
Thank
Mr.
you.
Given. For the photo moment, we're having a photo moment. Usually, don't we have the documents in front of us? Okay, sorry. After let's wait for Miss Uganda to append their signature and Mr. Uganda. Things are changing, eh? We have Mr. Uganda, you people. Had you known? Mr. Uganda. Soon I'll be Mr. My Village. I'll be Mr. But the choice of these colors of markers, there is no red. Was that intentional? There is no yellow. You can see colors here. Okay. My multimedia people, how are you doing the photo? Where are we standing? There? Okay. Do we need the documents in front of us? The documents are too short. They are too tall. We can have them off. Yes. Okay, please organize your thing, whatever you want it organized. Okay, are we done? You organize us. Organize us. Why don't we have that in the background, Mr. Multimedia person? Excuse me. My young people, please come and help me pick these documents. Okay. There, and even those. These ones can go away. Sorry. My young people, have this one that way. Now, this one should go away. Okay. Are we ready? These cameramen. Cameramen of our time, when they were going to take picture, they would go down like this until you count. When I count 5, you say Fene. But these words of these days, Yama, we want to move. Okay. Before you know it, they will say we have finished. You see? They say we are done. And then you start asking who is done amongst us. All right? Okay. How can
all right.
Okay.
Thank you.
Now, there's a special request, Mr. Chief Guest, as the rest of us are leaving. We need to have a picture or a photo with the function. Young people, please. Young people, come on. You should all of you be here. All young people should be here. So if you're a young person and you were here, did you leave? And the young people are mad. They don't want traditional things. Yes. Some madness. No, that's young. No, that is young. Some of them are sleeping down here. Will you fit? Okay, it is simple. The tall one is in front. The young people, some madness! Yeah! If you have not taken the picture, to Mazay.
And that's the picture for next year's calendar.
Yes.
So make sure your faces.
Okay. On the count of 1, 2, 3, make some noise. 1, 2, 3. Let's go!
Beautiful. Beautiful.
Yes. Yes, thank you. Mr. Chief Guest, before you leave, people are telling me these young people stay in the local governments. Let's please accept to have one more with the local governments, please. The local governments from the districts. District leaders, please. Young people, leave. Please, young people, leave. Young people, leave. District leaders, please. And now the cultural leaders are like, what about us? District leaders, please. District leaders, please. District leaders, please. Join in. Join in, join in, join in. Ah, this madness of young people, you are distracted, eh? You better stop. District leaders, who is seated here? Now, where are my documents? The documents have been stolen. That quick. You guys will never see heaven. Okay. District leaders, there is space here. People, you see, district leaders are very formal. I love this. Okay. Who else is left out?
No,
that's enough.
That's enough.
All right. Thank you so much.
Thank you.
Thank you so much. Multimedia people, you guys are done. Justin, I did not know Katoch can take a good picture. Okay, thank you so much. All right, thank you so much, ladies and gentlemen. Over to you, Commissioner Mondo.
Can I request Eileen to lead the chief guest to the Innovation Village tour at the back on perhaps his way out of here to go and attend to other equally important businesses. Thank you very much, Mr. Permanent Secretary, for sparing time to be with us. We really appreciate. We know how busy you are, but for having found time to be with us, we don't take it for granted.
Thank you so much. Thank you. Thank you. You see, Commissioner Mondo had promised to invite me back. But before he invites me, let me remind all IPs to get to their stalls, because the chief guest will be having a tour of those exhibition villages. Please make sure you share with them what you people do. And in line with adolescent health and everything that you people are working on, please. So get to your stalls. And I've been reliably informed that our DG is around the corner, so we'll be joining in. And hopefully when they come in, they also sign off on the documents the chief guest has, and we'll be getting ready for the next phase. I've also been told, and I have seen, that they will be awarding outstanding partners in the adolescent health arena. So please, start scratching yourself. It might be you. Words are there. Let me see. I've seen names of me. Am I a partner? No. So just get
Amon.
Get ready. Get ready. Get ready. DJ, that soft music in the background will do us a lot of good. But of course, to ensure that the chief guest hears what the partners are telling him. That's one already.
you work with the schools as well?
Yes, the government program is in schools, so we have chapter leaders who are in schools and they are support. They have a different education program. Usually below students in schools, and sometimes when we have events, we go to schools like education program outside. We are in primary school where we go to schools.
So PS, one of the vulnerability is livelihood. I'm the country program director. For HF, the common name is Uganda Kids. So we have empowered the young people. And she has said it's all about the program.
This is excellent one.
Sure.
Congratulations.
All right. Ladies and gentlemen, thank you so much for keeping it here. And we love you for your patience. That's what young people are. And in a few, I'll be handing over. We are honored by the presence and the of our DG, who is in the house already. Mr. DG, you're welcome. Where are my young people? Can I have 3, please? Need help from young people. But is it that young people are seated only here? When I call out young people, it's only these that come. Please come. You remember the story of Jacob and Esau? Hey, someone will take you Mukisa. I want that one here. Leave the things back here. If you become a military, bring them here. Thank you. Here. You see? You could even do that and lift it. So put it here. The way they were during signing. Please take care. Don't hurt yourselves. No, this one has broken. What is happening? Okay, you put back these documents. Bring that one this side. The short one this side. Put where the documents? Get the documents and put them on. Okay. The markers out of here. Yeah. Okay. Thank you. So, ladies and gentlemen, along the way, as the chief guest is having a tour, a guided tour of the work that the IPs are doing, after that, we'll continue with the function of appending our signatures for about 2 minutes, because the Director General was not in by the time we did that. So he will be led to append his signature. And at that moment, or at that time, even the partners, I did not see any partners append their signatures on these documents. So even the partners will be given chance to append their signatures on those documents. Thank you so much.
speaker finding his way, and I'll be introducing him and inviting him to speak to us. Meanwhile, I want to request some of you who were not part of the tour, take your seats so that we can plug into the session before lunch. Lunch has been delayed a little bit, so bear with me, but lunch will be ready. Mugenda Wala.
Commissioner Mondo, Dr.
Yes.
Mugahi is complaining that he did not get a chance to have a
because he came late to be returned by Dr. Mugahi can find a way around the outside there. Emon, you can't, but that's what protocol demands. I cannot pray it back. I cannot pray it back, unfortunately. I'm sorry, but I'm guided by the standing protocols. Uganda have a job to protect. All right, ladies and gentlemen, let's take our seats. Let's take our seats. The keynote speaker is already here with us, and I want to introduce him to you. Dr. Ndawala is a seasoned planner who has been behind almost development plans, from Development Plan 1 to the current 4th. He has also promised to be there to handle the 5th and 6th development plans. Director of Policy, Research, Innovation at National Planning Authority. He is an education economist, a social sector planner, and a certified professional. Dr. Hamis Mugendawala has been involved in project and policy evaluation, research and strategy development for a number of years at the National Planning Authority. He has been trained. Dr. Hamis Mugendawala, University of South, a master's degree from University College of London and MUK, and distinguished researcher, planner, innovator, and is here to represent the Executive Director, National Planning Authority. Meet me in the same way. Recognize the arrival and presence of the service, Dr. Charis Ora, who is already here with us. DG, you can wave to the people. He is accompanied by the Ministry of Health. The gentleman, when he's back in the kingdom, is a Minister for Health in Toro Kingdom. Thank you for coming. Meet me, DG, now to invite Dr. Hamis Mugendawala to make a keynote address. Later, you're requested to sign on documents that have been launched. Thank you very much. Miss, you have the floor. Can you join me in welcoming Dr.
So,
that's very good.
Thank you very much. I have already been introduced. I sent in a few slides that I wanted to share with keynote. My of you have already listened, because the keep each other, the messages keep repeating each other. I work for government, and I want to set the record clear. My current position is Director Population and Social Development Planning at National Planning. Wanted us to have a conversation on adolescent issues from the planning perspective. I don't know who's managing the slides. Going forward, you go forward. So I want us to share from a planning perspective on the status of us, the adolescents. The planning framework, our health is anchored, or our well-being, the progress, and
can you help me request my team to put the documents aside for now, okay, so that the presentation is visible. Amon is the youngest here. Even if states, but these two. Thank you. I have a very robust. Thank you.
Thank you very much. Going forward, this information has been fed to you all the morning, and nothing much new here, apart from coloring some of them. But in a nutshell, what adolescents, the key message is that we are the majority now. The young people are the majority. That's why you see from the statistics that 50% of us were born between now and 2008. And that is a very young generation. Just but then from the same slide, we see that whereas these numbers show a risk as well, just like our colleague from the ministry indicated. And the risk is that the numbers are supposed to be capital that should bring the country to its development goals. Is the numbers capital themselves. If you see that of them are not completing basic education, by the way, government policy now, every young person who enters school must stay for at least 11 years. That is from P1 to senior 4. Because according to the evidence, when a special stays in school for at least most of the from the population pyramid, that whereas we are desirous of transforming our population structure, most of the countries that have developed have a particular of. There's no country that society with such a population structure because of the challenges that it presents. Going forward, I wanted to share some of to face. From the 24 census, we see that the likelihood of a young person in Uganda to early sexual is really high. It's 1 in 5, which is 20%. But for the young men, this is delayed for many reasons. We also see that as the young people are now carrying the greatest burden of HIV, where we are explaining 70% of the new infections, and of reasons that are explaining that exposure. The big is catching up with us is the mental health. Mental health across the entire population, but it is quite significant amongst us, the adolescents, because concern abuse, illicit waste, academic pressures. You know very well that now some schools, especially in candidate classes, young people have to wake up at 3 a.m. to classes go on sometimes to 11 p.m. and that is stressful. In terms of nutrition, there is still a risk where we still have young people who experience security, access to clean water, particularly in schools and the different institutions. When you come to school, which is the greatest variable for capital, we see there's been a lot of young people in school, but if you followed those that enter P1, only 18% will finish senior 1 and senior 4. Now, these implications are against government policy, because government policy is such that every young person education, which is 1 to P7, then to senior 4, that is government that just aim for S4, but it is saying that the worst expectation should be that when you join, at least stay in school for at least 11 years. Then school. Going forward, I wanted to share on the anchoring of people that in 2010 or 2007, government decided to drift away from eradication action plans, the PEEPs, to a medium to long term. So we decided that rather than trying to have short-term plans that are supposed to respond to poverty, we needed a little bit far away and decide 30 years to come, that is 2040. And the Ugandans said that our aspiration is transformation from a society that is peasant to a modern and prosperous country. Now, when you interrogate the vision of the country with the lens of health, the vision envisions a country where every citizen enjoys access to affordable, high quality and preventive health care. A country where health financing is sustainable, and inclusive through, among other models of financing, including insurance and public-private partnerships. And a country where health systems are driven by modern technologies and regionally distributed. That's why currently you see that every region has a regional referral. And a country where citizens are healthy and they form the backbone of a prosperous, competitive, and equitable society. Now, going forward, you realize that government decided that we have a long-term dream, and this dream is going to be implemented through medium and short-term plans. And that's why we decided that for the 30 years vision, we shall implement it through 6 5-year development plans. And so far we've implemented 3 5-year development plans, and now we are implementing the 4th National Development Plan that we started implementing on the 1st of July 2025. And this is supposed to take us to 2029, 2030 at the time when the SDGs will be coming to an end. Now, when you look at the National Development Plan 4, our well-being as young people is planned predominantly in a program which is called the, and this has significantly helped prevent their population from falling sick. You know very well that about 75% of our illnesses, that's what research indicates, is preventable. It is mainly arising from us eating, drinking without washing our hands. It's about neglect, ideally. And so, given that most of our illness is preventable, it then becomes a logical step to focus on health promotion and prevention. The NDP4 is also focusing on providing for adequate human resources for health infrastructure, medical equipment, vaccines, medicines, supplies, and different health technologies. Because you know very well that we've performed excellent in terms of immunization than other our peer countries in the region. But also, NDP4 is asking to get more health out of the resources that we allocate to health. And that is the improvement of allocative and technical efficiency within the health sector. Going forward, I wanted to share with you, from where we sit, these are some of the things that are working, especially for the young people. We've realized that empowerment, particularly economic empowerment, is very, very critical in ensuring adolescent well-being. And the example I've picked here is that when you enhance livelihood opportunities that are aimed at reducing poverty-driven vulnerabilities, such as early marriages, transactional sex, and risky behaviors that compromise adolescent reproductive health. We've found that this is working. It's rare to find families that are economically empowered, giving away their daughters or allowing their young sons to marry before ending school. You find that most of the children who get pregnant or married early, they come from societies with the that are the lowest income quintiles. I'll give you an example to illustrate how poverty perpetuates harm as the adolescents. In 2018, National Planning Authority embarked on assessing the impact of universal primary education policy. And when we went to Namutumba district, we found a little girl at the district education office, and she had come to plead to be allowed to sit examinations even when she was pregnant. We were touched by this pregnancy came about. And she said that she came from a poor family that was struggling with sanitary hassles. Spoke to her and said, you know what? We can no longer cope with your sanitary needs. But do you know that if you got pregnant, this need will go away? And this was a spark that encouraged her to get pregnant, such that the burden of providing sanitary towels can go away. And a lot of young girls, when you speak to them, the marriages they engaged in is because mainly of the in their lives. What is working as well in trying to address the well-being of young people is education and health outcomes. Like I've told you, people, especially girls in school for at least 11 years, and education and training delays early pregnancy, increases health literacy, and fosters positive behaviors around reproductive health. This is illustrated. You find inspectors on our sites, and you find very many young people there with skills. They are making different products. And you really see they are about, and this is you come to educated young girls. In most cases, educated young girls will marriage, they will delay childbirth, and so they will collapse most of the complications that are associated with teenage pregnancies. We've also realized raising access to health, access to preventive and curative care for adolescents, especially in the rural areas. Taking some statistics now, that 90% of health facilities are located within a radius of 5 kilometers from most of the households. This is not to say that this is the case everywhere. You may find different variations. This is where we are. And we've also seen that when we help equip them emergency infrastructure, like what we've cited here. In the last 5 also, I've been looking at statistics from the Ministry of Health that they functionalized 81 health center 2 and as well functionalized 369 health facilities. And this has really led to improved adolescent responsive family planning services, and partly this explains some decline in the total fertility rate, which is now 4.5 children per woman from 5.2. But then this is still a lot because we've been doing some modeling, and we've been following countries that have taken off and are developed, and realized that there is no country that has ever taken off in terms of development with a total fertility rate of four children. It's not there. So it means that we must continue having quality families that we can afford. Because in most cases, the people who have very big families cannot afford them. Recently, you saw a gentleman from, I think, Kumiro or Kagadi with 63 wives and 185 children. And his intention is to make it to 300 children. But again, is asking for government support for education. And then you wonder the justification for having such a very big family that he can't afford. We've also seen that surpassing the 95% HIV testing and ART coverage rate, and increasing the testing coverage for different sexually transmitted diseases is contributing to a healthier adolescent population, and it's as well guaranteeing healthier transitions from adolescence to adulthood. But also, we've realized that nutrition is playing a key role in giving us a signal in regard to what our population might be in future. And now you can see that a reduction in the stunting that we have registered among children, which is now around 26%, and a reduction in wasting, which is around 2.9%, is giving us hope that our adolescents might become resilient as they transition into adulthood. Going forward, I wanted to share with you on what we are talking about today. Today, everyone has ably justified multi-sectoral approaches to adolescent well-being. And I cannot do more than what others have indicated. Why? Because younger people, to bring up a young person entails entire society, national and subnational institutions. What we know at National Planning Authority, government, the greatest need of adolescents is human capital. By human capital, we mean investing in their education, investing in their health, investing in their security, investing in their nutrition. Now, the country has already realized the need for multi-sectoral approach. And as we talk, the planning frameworks have changed. We no longer plan at sector level. We now plan as a program. And that's why you see that the Human Capital Development Program is mainly led by 3 ministries. That is the Ministry of Education, the Ministry of Health, and the Ministry of Gender, Labor and Social Development. And this justifies, or this reflects or illustrates the criticalness of different constituencies of institutions coming together to plan right to this young person that we need. Also, you realize that currently the country is emphasizing integrated life cycle planning, budgeting, and monitoring. Whatever planning that we are doing is following a life cycle from conception to death, and that illustrates the importance of multi-sectoral approaches. You can see that currently we are trying to emphasize evidence-based targeting, where you focus attention on specific groups where data is pointing gaps to exist. Pooled resourcing is another practice that government has. Now you're seeing a lot of public-private partnerships, whether in health, in education, and the different spheres of life. Then you see that multi-sectoral approaches are also reflecting empowerment community structures, where you see different institutions, including village health teams, school health clubs, and youth councils acting together to promote sexual reproductive health, mental health, and life skills. But most importantly, government has realized the importance of involving young people in deciding their destiny. And currently we are talking about co-creation with young people, monitoring together, and advocating together. In conclusion, from where I sit, we see that adolescent health and well-being requires coordinated action across all sectors. And it is our view that achieving effective multi-sectoral coordination requires clear leadership, like others have said, move on. Shared accountability, joint planning across the different sectors that explain our health. I thank you.
I know we are moving towards lunch, but you can afford to clap better for Dr. So if some of you thought doing a good job, I mean the many here, you have had that man from Kakumiro, 60 wives plus 190 children. I leave the rest to you, whether he's living responsibly or not. But also, Dr. Misi, you remember of another young man who told us that he had medicine for them not to go through menstrual periods. And so what he did was to sleep all of them, with all of them 6. They became pregnant, and so they could not see their menstrual cycle 9 months. And so there is still a lot of ignorance outside there. Also tells us that no country has made it through with a fertility rate higher than 4. But also it tells us that many of the diseases we're suffering from are preventable. Some are out of not washing your hands and eating, and a lot of other things that we do that make us not responsible citizens. Because if in the 21st century you wash your hands before eating, then I think we still have a problem. So let's clap for Dr. Hamis once again. I want to propose that we hold it here and go for lunch. I see people seemingly nodding even when I'm not making a point. Yes, meaning that you are tired. But I have a colleague from Minister of Education, Mr. Henry Semakula, who is going to utilize just 3 minutes. He's supposed to be part of the next panel, but he has been summoned by the Minister of Education and Sports. And you know who the Minister of Education and Sports is. And so I'm hesitant to resist his request. I would rather request him to utilize 3 minutes and you say what you want to say. And with what we are talking about here.
Thank you very much for the opportunity. I'm supposed to be part of the panel coming next, but as he has indicated, I can't make it then. Very quickly, we are reminded that education is the most powerful deterrent in early motherhood, and we want to confirm that. But after being told that, we are asked what concrete actions is the ministry taking right now to enforce the policy of re-entry into school. And in the 3 minutes I have, I'll tell you that first of all, we developed the guidelines for re-entry. Secondly, we disseminated and popularized them. Somehow, they were not well received in some circles, but went back and re-engaged those who were resistant. We went all over radio and TV popularizing the same guidelines, but we also used any other fora available, including churches, to ensure that the guidelines are known. We also hosted several head teachers and several teachers, including senior women in particular, to inform them about the goodness of the return of teenage mothers to school after they have delivered. We also moved ahead to engage our very minister, the Honorable First Lady and Minister of Education and Sports, as a champion of the girl, and so she actually mobilized other very key leaders in this country, including the Prime Minister and the Speaker, champions of re-entry and the fight against teenage pregnancy and early marriages. We also continue to work so well with the Minister of Gender, especially in popularizing the parenting guidelines, but also in encouraging teenage mothers to get back to school. As a ministry, we have also put many options for the girls to return. They can either return to formal school and get to senior 1 or 2 or 3, but they can prefer to go to technical vocational education and training, which Dr. Mgendawala has been emphasizing, but they can also go for any other skills available, including joining the skilling hubs put up by His Excellency. Those are managed by another ministry, but we encourage the girls who can't get back this way to get there. We are also working with Ministry of Health and other ministries to ensure that the girls that are teenage mothers are linked to support services available, and with gender we hear of such issues as the youth livelihood program and all the rest. We are working close with them. But you may also want to know that as a ministry unit that continues to pursue this, as well as a school health technical working group, and we are also members of the Adolescent Health Technical Working Group at the Ministry of Health. The second question they asked us, which I'm also going to answer in a minute, is how are we ensuring consistency of what they called comprehensive sexuality education, but I want to correct that at Ministry of Education, sexuality education, we said no to the word comprehensive because we didn't understand the details there. What are we doing with sexuality education? Number one, we launched a framework in 2018. The framework was disseminated and popularized, but again, it met some resistance. So fast forward, we actually started the process of reviewing that framework, and that process is led by the First Lady and Honorable Minister of Education, but is this time a multi-sectoral framework. It is not only for Minister of Education, other ministries are coming in. That is why we are already engaging Minister of Gender, Local Government, Ethics, Interreligious Council of Uganda, Religious Authorities of Uganda, and many others. Number two, even where we have a framework that is being reviewed, it doesn't mean young people are not getting any information on sexuality. You have heard about our historical PSA program, where we continue to engage. If you go to our schools, you'll find the schools talking. We call that talking compounds. And they talk a lot. They talk mental health, they talk HIV, they talk menstrual hygiene, and mention it. The other key thing to note is that beyond reviewing the framework, we also have guidelines on formation of school clubs, and we believe that young people can also tell themselves about their sexuality where the teacher is not present. So we encourage these school clubs to take up such activities. We also developed guidelines on guidance and counseling, which we sent out to schools. We are also struggling hard to ensure that schools are safe, and so we continue to train our teachers. We call it continuous professional development. We have also designed what we call alternatives to corporal punishment, and here we are supported by UNICEF. The teachers, instead of going for a cane, can go for anything else. We are reviewing and have reviewed already the lower secondary curriculum and integrated sexuality. We are reviewing the upper secondary to integrate the same. And where Dr. Mugendawala almost ended, he mentioned something to do with mental health, and the schools are challenged because of the programs. We do accept, but the minister has seen this. We have written a circular to schools on how to manage mental health, and we've encouraged them breaks, enough space for the young people to breathe. One of the key things we have also done is to send out a circular, restricting but also guiding the type of entertainment in schools. You had begun hearing of weird dances. We are guiding how they should proceed if they are going for a trip outside school, how many hours to spend there, etc., etc. I normally speak for an hour when I have time. Thank you very much, Mr. MC.
Thank you very much. Colleagues, you have heard what Minister of Education is doing and has done, working in a multi-sectoral nature. Now, as you go for lunch, if you remember nothing, remember this. And this is from Dr. Hamis Mugendawala. Healthy citizens form the backbone of a prosperous, competitive, and equitable society. You can replace backbone with oxygen. Healthy citizens form the oxygen of a prosperous, competitive, and equitable society. The good news, you have all earned yourself food. Can you go and have lunch? It's healthy for you to have a lunch break, and we are going to use exactly 1 hour. And can I hand over to Amon, just be called Amon,
all right, ladies and gentlemen, thank you.
Where we are going.
Thank you. Let's give a big hand to Commissioner Mondo. If you have not clapped after lunch, I'll tell you something. Thank you so much. And let's all give a big hand to Mwami Semakula. He usually speaks for 4 hours. Lunch is being served in Sunset Restaurant. I'm told it's 1 floor from where we are. Those of us with wheelchair, I'm told we can use the lift and press option 1. See you after lunch. Someone is looking at me. You want someone to pray for the lunch? Okay, very fast. Prayer for lunch.
Okay, let's humble ourselves and we pray. Our dear Lord, loving Father, we want to thank you for the gift of lunch that you're going to give us. And we pray that it serves purpose. Let's mind to keep time as we come back. Amen.
Amen. See you after lunch.
After lunch is what time?
1 hour? The organization that invited you
MOU with them, and we allocated them where there was great need.
As Thrive Group, we have been working in collaboration with the Kidum District Local Government and then Lamour District Local Government in the provision of SRH services and then the SGBV.
Maristops is taking the lead into service delivery of SRH services under the SAFE project for the young people.
Through our collaboration with the Lamour District Local Government particularly, we were able to see Palabekal Health Center for commission last year, and now they're able to do cesarean section to serve the refugee community that is in that area.
The program has given birth to improved integrated outreaches. We are able to interact with the refugees. At the beginning, the uptakes of contraceptive was a challenge in the refugees. But as we engage the different leadership, mindset changes has taken place, and even now as we talk, the demand for services is there.
We've worked closely with UNFPA under the SAY program with the implementing partners. We have worked alongside them in implementing capacity building for our frontline healthcare workers, especially the midwifery staff and the medical officers.
When you come like this particular facility, even as carry at the gate, understand the basic SRS information, including other provision of services. Because if the young people come to an institution, any point of entry they should be attended to. And that is the area that I appreciated, the quality of mentorship.
Our facility has seen an increase in family planning uptake from 27.5% to 7.8%, and that is total family planning uptake. But among young people, it has also increased because every day, because it has been continuous, every day we receive like 2 young people within the age of 16 to 19 receiving family planning.
The work between the local government, the CSOs and the local partners, and how it impacts young people. For example, in Lamour district, because of the empowerment the role model boys have received, they are able to mobilize their own communities and start teaching on sexual and reproductive health.
The SAFE program is going on well at my side in Akor Health Center 3. More youths are coming to the facility to get the service at the right time. I will also make referrals to them, sometimes on the family planning, those who are eligible to get the family planning methods.
As a role model for the boys, after getting the training, I managed to change the life of various young boys whose life was about to be spoiled.
I was once a drunkard, but now through the program they gave me, you know, when you're like a drug addict, it's difficult for you and from parents. It may also cause parental denial from home. And I was someone who is neglected, but now we are together with my mom.
Thrive and Care local collaboration is so good in my sub-county. There's a lot of changes that is being brought. We have reduced gender-based violence due to this collaboration.
Project ni wakonyo dano me kingang me community mamegwa kilok me kuku. Atie bene ki family chiel madong olo akonyo ki ikin me kuku mayot olo kumpeti go dwaka chaden ma aloga ti mabe kwogi and go wacha bene ni almost dong gidonyo kayo lega madong gichok twang la gi tingi.
This model man as a family in teaching us about domestic violence, whereby we have now restrained from such act. It has helped us to unite together with my madam, and at the moment as I talk right now, we are going to wait in church.
When we came and we launched the project, of course we identified our volunteers, we trained them. After training them for the YSLA group, we put girls into groups where we started the saving.
A great change. I'm seeing even in my group, most of the members, they are now doing their own business. We help them in saving, and they now have access to go to the hospital to assist for the health care.
We have our YSL agent. Upon receiving the training, and when she received a training allowance, she realized that she can do something that can take her to the next level. Now she has started a small business that she's running.
Time back, we have been receiving food from World Food Program. But when this project came in, unfortunately, the food has been cancelled. So the project has helped these youth to get their own money, to struggle for their own. Even if the food is not there, they can survive in the settlement.
We work with the school health and sanitation clubs, and when we go to those schools, we provide information on menstrual hygiene management, but also teach the members of the school health club on making reusable sanitary pads.
I want to send my words of appreciation to the SAY for their support to the young girls for what they have done. It has also supported us financially. It has helped. It has reduced that burden of buying.
When young people and leaders unite together, great things happen together. As SAY project, we are better together when we are delivering together.
Many young people once lacked opportunities, but through the She Showers project, they are building skills and shaping their futures. Meet Warom Noel, a young man who once had no clear direction, but has now found his path in Wellbeing.
I've been someone who has been studying, and I went through my studies and I dropped out immediately after doing my EPS. Trying to join a secondary school, but challenges are from parents and guidance, so and so, which let me down actually from schools. I was home with a friend. I collabed with a friend, but that guy is a youth chairman. Yeah, he's a youth chairman. He called me when I was on bike. He was like, "Hey, Warren, there's this organization which is coming. You guys have to join about something over welding, stuff like that." I had to tell him, no problem, I will join because nowadays I'm free and lacking such opportunity. Like after I was given the opportunity, I just went for it, knowing that I may make something in my future if I concentrate on this. In the training here, actually now, I've learned a lot. I can actually, including something like bull bars, something like block molds, something like pavers molds, something like fencing molds, and like deckers and doors, windows, including gates, so on. So these are the things that I can work on as per now. I don't see myself as before, because at least per day I can get free time. I see, although the little I have, yeah, that's money. I just get money. So it's changing a bit. It's changing from one to others. It's changing, yeah.
Sharon discovered her passion for tailoring through the She Showers project. Now she is designing and creating her own future.
Ma school ako ma bongo sore asle man fizu tailor lerni manda midropo school ar sibazi zaman chonga man chole sende suzu maseleyo aya ma sidible mo fian tailor ni sa sidible man bongo suzu man masele suzu ani masele asle la kana man sa si mani ya fai oyizo my demand base Sunday school. My demand Sarani saw Sunday man should over my dear for my letter pizza. Not only base. A man leko anzi like your quest drop school about the penny in Batardi. Pinasi bazo yo
Sasi Kani, but Minizu, Madra. I think so. Sir, if you were cat, I work in the school. I am the Mobakesi and Bataban and Wimbarale in Rumadia. And they keep it so and send the evil to
For Perry, this program has been a turning point. People used to belittle her because she lacked money. But through tailoring, she is shaping a new future.
Sarani, my dream. Manandra azo kweme romani ma fariki o korsiari andra bongo ka so bongo til malira ma resource nda duduse so ma baben mo je charandra sen rayo man chozu mozo charani dileba ka avode ni ba dudi belen anjiki so ba diben charani Daddy ben sarani. Ben country mudini zuba. Haka ben masende kisuba masine yo. Maniga mavula yore. Masine rikida. Yani weni. Hizo nandra manazu. Saran koko mera sende akodri. Bauran dangone riban zinera. So mabeni mafaridego.
Gilbert never imagined working with metal, but today he builds and repairs with confidence.
Yeah, and the Naguru Fitness Center selected me and they took me to the school. They gave me training for welding training. I spent there 2 months in training. And they are giving me the starter kits like a grinder, transformer, and the designer. And they are giving me all these tools. Now I get money here. I support my family for food and money for sicknesses. Even for my clothes, I used the money. I get it here.
Since the inception of this project in 2022, we have moved miles, tremendous impact. I would say that we can attribute to the contribution of the CSOAS project in the region. We have seen young people being empowered and young girls accessing sexual reproductive health services and commodity facilities. We have also seen transformation in the lives and behaviors of young adolescent boys, and we have seen young people who are skilled, who are able now to meet their daily needs by the skills that they have got and the savings that they have earned from these skills that they have got. So I would say broadly, the CSOAS project is impacting in the lives of the young people and also contributing to access for sexual reproductive health services in our health facilities.
In the heart of Sebei region, where rolling green hills stretch endlessly and waterfalls carve through rocky cliffs, life unfolds in breathtaking beauty. Yet beneath the serene in hidden caves and remote villages, a painful tradition continues, one that has shaped generations.
FGM and child marriage are rooted in the people of this region.
The thing to show that you are now offered to be married is the circumcision.
I said that before we carry these women, we sleep with them the whole night. Very early in the morning, we bring them to the river.
Female genital mutilation, or FGM, is deeply rooted in the culture of Bay people. Meet Jasea Sauda, a reformed FGM surgeon who started the practice in 1997. She was eager to learn, believed she was preserving the culture of the Sebei people. For years, She relied on the practice for financial survival, earning respect and recognition as a skilled traditional surgeon.
This thing helped me because I don't have somewhere to survive. If someone has, another girl has come to me to give me something and then they help me. Now, since this exercise brought a lot of losses, some girls can die, some can go get married when still young. I have now.
Today, Sauda is reformed. She has abandoned the blade and now speaks out against FGM. She teaches communities about the dangers of the practice and advocates for alternative rites of passage.
Now I'm advising my fellow people to stop cutting girls and they take them to school.
FGM, because it's in culture, it's taking us back to 8 years. FGM has greatly led to death. This is due to overbleeding, where after circumcision, girls can overbleed.
If you cut a girl, there is somewhere where the knife cannot reach. And if you cut there, the girl dies. And if the girl, you examine very well that, is she pregnant? And if she is pregnant and you cut, she dies because she bleeds until she dies.
Girls like Cherub Jemima are not only realizing the dangers of FGM, but are also taking action. They are mobilizing peers, engaging with community leaders, and advocating for lasting change. Their voices are breaking the silence, paving the way for a future free from FGM.
The government should come out with sponsorship programs, because most of our parents believe that they are poor and they believe they cannot take us to higher schools because they have no money. So if the government comes and they give us sponsorships, we can be able to study, and most of us can get to know the side effects of FGM, of circumcision, and we can get out of it.
Religious faith-based organizations here in Bukwa who have been talking to our elders that please try to live this culture of mutilating our child. Number two, actually we have been talking and advocating for thanking the government of Uganda, bringing in the DM. Actually, this aspect of grouping, actually identifying the people, these are the search mentors for FGM. If we bring them as a cluster and give them this BDM fund, I think slowly this cry of maybe the promises that have not fulfilled the promises, it will come down, it will decrease.
And the key message that I want to pass out is that the way the world is moving, this should be to our people, my people, the Sabines, and other people who are still hiding this thing, because now it was outlawed. It should not be, there is nothing good in doing this. And we all know even, I don't know why people are still sticking to this. But when you move out, it is not so much, but there are those who are still hiding it. We should come out, we should leave it, we should drop it quickly, because that is how even God wants us to be. We should appreciate God's creation. We should not tamper with it. That is something that we should appreciate, and we should go by it.
As an organization, with support from UNFPA, we are committed to ending FGM, genital mutilation, in the Sabay region. Through education, advocacy, and community dialogues, we work hand in hand with former practitioners, young activists, religious leaders, and families to create lasting change.
In Karamoja and Sabay, one of our strategies or projects that we're implementing, it's the global program to end FGM, genital mutilation, and child marriages in the region. While implementing these, one of our strategies, we're basically looking at community involvement in all the programs that we do. We just had a dialogue with the local leaders, the elders, cultural leaders, and the different stakeholders in the community. And we were so impressed with their discussions we had. One of the key issues that came up was their readiness towards ending the vice in the region. We also had most of the elders appreciating the importance of education in ending child marriages, where we had majority of them committing to start sending their children to school, sending their grandchildren to school. But also we saw religious leaders being brought on board together with the cultural leaders and the traditionalists, or you may call them the herbalists. They also came on board, appreciating the need of a positive cultural norm as an alternative rite of passage against FGM.
No woman or child should die during pregnancy or childbirth.
In Uganda, 1 in 4 adolescent girls aged 15 to 19 years are pregnant, and 7% are married before the age of 18.
To me, safe motherhood means young people should access sexual reproductive health information which is appropriate from the right service providers and also services when they need them.
Safe motherhood is about having my newborn baby safe after childbirth.
Ensuring that all my children are vaccinated to keep them safe from disease.
Early sexual activity leads to health risks, such as increased HIV infections rates, unplanned pregnancies which end in unsafe abortions, a leading cause of maternal death among young people, and 60% of unintended pregnancies are among adolescents.
No adolescent girl should be pregnant. No adolescent boy should be a father.
This leads to a never-ending cycle of poverty and mental illness that accompanies the stigma, neglect that young mothers face in our society.
Safe motherhood also means freedom for me to use which family planning method I can use.
Teenage pregnancies contribute 24% of maternal deaths in Uganda. Babies born to teen mothers are often born too soon.
For the adolescent,
having a good start using nutrition as a foundation.
Before, during, and after pregnancy, to ensure that the mother and the baby
can have an enjoyable pregnancy and also have a fruitful birth.
To me, safe motherhood is attending 8 antenatal visits and delivering your baby in a health facility.
Having my partner accompany me to the hospital during birth.
It is about that my partner accesses a health facility whenever they are required to.
Safe motherhood is all about a pregnant woman delivering in a pair of safe, skilled hands. So, visit the nearest hospital if you should deliver a baby.
To me, safe motherhood means every girl stays in school and attains their best potential, or they return back to school.
We must act together in a multi-sectoral approach. Parents, the media, religious and cultural leaders, to prevent teen pregnancy and protect the future of our young people. Thank you, Navio, for joining this course as a male influencer in safe motherhood.
My name is Dr. Sabrina Chitaka. I am a pediatrician. I'm also an adolescent medicine specialist. To talk about sexually transmitted infections. You know the common ones are gonorrhea and syphilis and HIV, but there are others like chlamydia, trichomonas vaginalis, genital herpes, herpes simplex, pox. I'm not here to scare you, but sexually transmitted infections are really common especially among young people and college students. Some of these infections cannot be cured, such as HIV. Therefore, if you feel unwell, if you have a sore on your genitalia, if you have rashes that you do not know about, make sure you see a healthcare provider who will test you and start you on treatment. And also make sure that your partner is also treated. As Ugandans, we must ensure that the young generation grows and grows up to reach their fullest potential. As parents, it is your responsibility primarily to talk to our children about preventing them from getting sexually transmitted infections. They can wait, and waiting is hopeful. Teachers, religious leaders, be part of this call to action to ensure that our young people stay healthy. We are all in this together. We must protect them. We must make sure that they are healthy. And in being healthy, we need to support them to be part of the change that we want to see. STIs can be treated, but some have no. Do not do that.
My name is Diana Ondoga. I serve as Manager Corporate Social Investment at Stanbic Bank. Anyone between the ages of 13 to 19 is at risk of gender-based violence. It can happen at home, it can happen in church, it can happen at school. Are you a parent? Are you a teacher? Are you a primary caregiver? Are you a community leader? Are you a leader in the church? We have a responsibility. We have a responsibility to look after our future through protecting the children against gender-based violence. The three forms of gender-based violence, physical, social, emotional, or psychosocial, are things that we can do something about. We live in communities where this is happening in our neighborhood. Do not be quiet about it. Do something, say something, speak up, and let us be champions for creating equal opportunities and fighting against gender-based violence.
My name is John Magezi Ndamira. I've been a Rotarian for almost 28 years. Young people, ages 10 to 18, face lots of challenges as they grow up. Almost 25% of girls under 18 get pregnant when they are still young people and they cannot manage the challenges of pregnancy. But I want to address the young girls that learn to understand that even when you take independent decisions to make relationship outside your home, in your community, in your school, let your parents know. Let your brothers or sisters know. When you are leaving your home to go for those social parties that you always attend, let your brothers and sisters know where you are going, whom you are going to be with, and where you are. Because it is important that you are guided in these relationships. And when you are there, take decisions that will benefit you. Learn to say no when it is a no. If you don't want to take drugs, if somebody asks you for a sexual relationship, learn to say no and report what has happened. That will protect you. And to the parents, understand that the children of these days are better informed than we were many years ago. Through the social media, through the TV networks, through radio, through TV, everything, newspapers, magazines, as you talk to them, give them the respect that they individuals. These kids may know more than you probably think. Talk to them with respect. Listen to them attentively. Don't rebuke them. Don't harass them. Don't command them. But seek to understand what they think and be able to guide them from that point of view. And the young boys and girls, when you get those challenges, abuse, harassment, peer pressure, don't keep those problems to yourself. They grow and they will be a big burden on you. I would recommend that if you are a girl, talk to your mother, your big sister, talk to your auntie, talk to your female, talk to a female colleague that you respect, that will understand you. But that person is a person that you trust. If you're a young boy, talk to your father, talk to your big brother, talk to your male teacher, talk to responsible people in the community.
Hello, I'm Geoffrey Chitakule. I'm a Rotarian from Rotary Club of Kampala South. I'm also a parent, 2 teenagers. I've also been a young person before. As a young teenager in King's College, Budo, I faced the same peer pressure that you're going through. I'm appealing to you, young man, that use this time of your teenage years to build your career. Make sure that within these years, you develop skills that will help you in life. Be able to communicate, be able to read, learn vocational skills, even if you've missed out maybe going to secondary schools, play games. All these skills will help you in your lifetime. Without you as young people, we can't develop. Let's not waste our youth by getting involved in drugs, by getting involved in early sex. You can actually make another person pregnant, but you don't have the resources to look after that child.
Hello everyone, my name is Barbara Kasekende and I work for Uganda Development Bank. I'm the Business Advisory Manager. In a nutshell, I help businesses get back on track. The subject today is teenage pregnancies. It is very sad to see that in Uganda today, 1 in 4 women gets pregnant before the age of 18. And why does this normally happen? Most of the girls today tie value to material things. And this is because our girls are not empowered. It is our duty, you and I. We need to show them that value is not tied to material things. We need to make sure that we skill them and we educate them. And that is education both within and without the classroom. So the pregnancy has happened. What do? Does that mean we shoo them away? Make them feel guilty for what they have? No, we help them get back on their feet so that they can be able to express themselves and add value to this narrative. Yes, we know this issue is here, but it's you and I who have to ensure that it actually does happen. So let's make sure that we educate these young ladies. Let's make sure that we hold their hands. It doesn't matter if I'm in the corporate sector, in the public sector, in the informal sector. We all have a duty to ensure that our country has girls that are not stigmatized by things like teenage pregnancy. Ladies and gentlemen, let's end teenage pregnancy. Thank you. Welcome to our 2025 video for the Denmark-funded Strengthening Adolescents and Youth Rights and Empowerment program, a program that seeks to enhance the utilization of access to sexual and reproductive health for young people in PG and host settings of the districts of Kitgum, Lamu, Moyo, and Adjumani.
In Paravec settlement here, we are delivering services better together.
Kitgum District Local Government is in the driver's seat. We are leading all the CSOs in terms of their implementation in this region. We signed MOU with them and we allocated them where there was great need.
As Gulu, we have been working in collaboration with the Kitgum District Local Government and then Lamu District Local Government in the provision of SRH services and then the SDG services.
Maristops is taking the lead in service delivery of SRH services under the SAFE project for the young people.
Through our collaboration with the Lamu District Local Government particularly, we were able to see Palabekal Health Center for commission last year, and now they're able.
Oliyo n'okula obonire eje mpindukayo mbi neyanje tinkiikiriza ebiteekateeko by'abantu kuhindura embeera zanje.
Ekintu kyonka ekinkwenda kinsindikirize n'ekirooto kyange nintora n'ekinyine kurwana nakyo kandi ninsingura
nyowe tinkahinduka kubahikamu ninyeyemerera aha bwanje aha bwitu.
waba olina ebyokuteganisa gamba nabo kufayo obuyambi bwabo nibukuyamba kwemerera n'amaani
nitula n'ebyomumisho byaitu tusigala tuhamye
lwakwaki aha bold league baba mazima kandi osigala ohamye kandi obeho n'omugasho toyine kukulata abantu niwe olukweteekateekera omuhanda obulamu nibukwishikibwaho ekitongole ky'ebyamagara nibakolagana na USAID.
Ogenda byaddala bambi
enenkyukakyuka mu mubiri yange sijja kukkiriza ndowooza ya muntu kutataganya ndabika yange.
bye neetaaga byokka okunteekako amaanyi bye birooto byange nonda ki kye nina okulwanirira era mpangula
sikyuka okujja mu bo nsigala ku mulamwa mu ngeri yange
engeri yaffe. bw'owulira ng'olina ekikutataaganya jogera n'abo abafaayo obuyambi bwabwe bujja kuyamba okuyimirira ng'oli mugumu. tulonda obulamu bwaffe obw'omu maaso tubeera nga tuli bavumu.
tukwaniriza mu bold league. beera mutuufu, beera mugumu, beera ng'oli wa mugaso. tolina kugoberera buli bikolwa by'abantu. gwateekateeka ekkubo. obulamu bukutuusibwako minisitule y'ebyobulamu nga bali wamu ne USAID.
Welcome to our 2025 video for the Denmark-funded Strengthening Adolescents and Youth Rights and Empowerment program, a program that seeks to enhance the utilization and access to sexual and reproductive health for young people in the refugee and host settings of the district of Moyo and Adjumani.
Services better together.
Kitgum District Local Government is in the driver's seat. We are leading all those in terms of their implementation in this region. We signed MOU with them and we allocated them where there was great need.
As Drive Gulup, we have been working in collaboration with the Kitgum District Local Government and then Lamour District Local Government in the provision of SRH services and then the SGBV services.
Maristops is taking the lead into service delivery of SRH services under the SAFE project for the young people.
Through our collaboration with the Lamour District Local Government particularly, we were able to see Palabeka Health Center for commission last year, and now they're able to do cesarean section to serve the refugee community that is in that area.
Given birth to improve integrated outreaches. We are able to interact with the refugee.
Reverend, I said give your neighbor a Christian hug. So as young people, let's just give ourselves Christian hugs. Yeah. Okay, so like Amon has said, this afternoon we are going to have sessions, but you know we are bad on time, we are not doing well, so we are going to be brief, but we want to ensure that we come out with something very good. So in the session, the earlier session, we had different people append their signatures on the different documents. So right now, it's the time for the implementing partners. But before the implementing partners come, I would like to invite the DG. I would like to invite the DG, escorted by Dr. Irene, to come and append his signature on these documents. So as the DG appends, let's have the different IPs come and also append their signatures. I can read some from here. Nakuru Teenage Center, Plan International, SRHR Alliance, Maristops, the different implementing partners. Where are you? Please come. The different IPs. We have also representatives from schools. Can we have some people from the schools also to come and append their signatures? SRHR Alliance, we are waiting for you to come and also append your signature. Can I have someone from SEHAD to also come? Please, the IPs, peer to peer, don't sit. Please come and append your signature, because once this time is over, you shall not have any other time. Thank you, our DG. Please let's hurry. Thank you, DG, for allowing to append your signature on the different documents. Okay, so the partners, please, if I have not mentioned your name, but you're an IP, please come forward. Please come and append your signature, because once this time is over, you're not going to have any more time for us to be able to do this. Do we have representatives from schools? Schools? Please, the schools, you can also come and do the same. I see this side is empty. We may not follow the queue. You can come this side and start from here and go that side and like that. No, you not knock each other. We have only 3 minutes to finalize with that. Only 3 minutes, so make sure within those 3 minutes, you've appended your signature on all the documents. We have 1 minute. Please summarize. Let's hurry. Okay, thank you so much, everyone. So our next session, we are going to have an intergenerational dialogue. So before we went for lunch, we had Mr. Semakula talk about a panel where he was supposed to appear, but because he didn't have time, he had to go. So we are going to have a discussion between the different generations. So whichever generation you're from, just know you're going to be represented. So the person who is going to moderate our dialogue is none other than Miss Brendan Katushabe. Are you here? Please come and take the floor and welcome your panelists. And you have 30 minutes on the dot. So we are going to be very good, very strict time managers. At the end of the 30 minutes, we shall be cutting off the panel. Thank you. Yes, please, 30 minutes.
Okay. Good afternoon, everyone. Good afternoon, everyone. Guys, this isn't the main conference. The main conference is tomorrow, so don't be too serious. Good afternoon, everyone. And you've already had the energizer just from having lunch, so this is a very right time for us to have this dialogue. I've been told that I have 30 minutes, so I'll straight away invite my panelists to come and take their seats such that we can keep time. Once again, welcome to this year's National Safe Motherhood Pre-Youth Conference. We are going to have an intergenerational dialogue, quite a mixture of voices from different sectors for us to understand how we can, better improve adolescent health and well-being. And on the panel today, I have Miss Nyamburu Martha. As I read your name, you come and take your seat. You come and take your seat, but they also clap for you. My beautiful audience will clap for you. Is Nyamburu Martha around? Okay, do we have Kakoza Paul around? Okay, Kakoza Paul right there. Please clap for him as he takes his seat. You're most welcome. We have Commissioner Maureen Atuhaire, all the way from the Uganda Police. Commissioner Maureen Atuhaire, all the way from the Uganda Police. Okay, right here. Please clap for my panelists. You're most welcome. Mr. Henry Semakula from the Ministry of Education and Sports. Okay, I've been informed that he has already addressed us. We have the cultural leader from Sebei. We have a cultural leader from Sebei. You're most welcome, sir. Please, a round of applause to him as he takes his seat. We have the Assistant Chief Administrative Officer from Namayingo District, Miss Soni Mulumbe. Miss Soni Mulembe. All right, you're most welcome. Please clap for her as she takes her seat. Please make my panelists feel comfortable as they are taking their seats. Yeah, it's not easy to sit on a panel and address people, so clap for them. We have a young person from the university, Jackie Namutebi. Is Jackie around? Okay, you're most welcome. You're most welcome. Please clap for Jackie. Okay, now, before we dive into our conversation today, we all understand that 50% of Uganda's population are young people under the age of 18 years, right? And more than a third of that population are actually adolescents and young people. So you and I can all agree that their health and well-being is really central to our country's development or to our national development. And that right there actually informs our conversation today. We want to understand how we can strengthen different multi-sectoral approaches and improve adolescent health and well-being. That will be our topic of discussion today. And you and I are all going to make sure that before we leave this place, we make a commitment to make sure that we address these challenges that our face. My panel here, as you can see them, is quite a mixture of different voices, right from the policymakers, the young people who live these challenges themselves. We have someone from the law enforcement body, and we have a young person as well. We also have a young person living with disability. So it's a mixture of different voices, and we really want to understand how we can all, play a role in making sure that we address some of the challenges that young people face. I don't know if you'll allow me, I'll take my seat, or you would like me to moderate from here. I think I'm missing one more panelist who is not around. In case you arrive, I had another young person. Okay, you're most welcome. Remain standing. I remain standing. I think it was intentional for to put 6 seats. All right, you're most welcome. And now that brings us to our discussion today. In minutes, I'll dive straight to the questions. Yeah, I want to confirm that these mics are working. Please, can you just say hi? Okay.
Hi.
Hello.
Hello.
Okay, I'll give you 1 minute each to just introduce yourselves to our beautiful audience, and then we can. I'll start with you. Yeah.
Yeah, thank you so much. Good afternoon to you all. Yes, by names I'm Paul Kakoza. I'm living with a disability, specifically visual impairment, and I'm from Tahi, Together Alive Health Initiative. Nice to be part of this. Thank you.
Thank you. Over to you, Ms. Maureen.
Good afternoon to everyone. I'm Assistant Commissioner of Police at Uhaire, the Child and Family Department.
You're most welcome, Ms. Atuhaire. Over to you.
Good afternoon, everyone. Good afternoon, everyone. Wow, that's really great. My name is Martha Nyaburu. I'm a BMM shifter as well as a youth champion, volunteering with Save the Children. I also serve as a youth advisory committee member at the SRHR Alliance, representing Straight Talk Foundation. I'm a mental health advocate as well as I co-found BMM Shift Group, and I serve as the vice chairperson there, a mental health advocate group. Thank you very much.
Wow, our whole page profile. Please clap for her. Yes, over to you, sir.
My name's Peter Swilike Kisa, and those who have crossed the 50s, that name I think rings a bell. My background is in television journalism, but my new capacity is the cultural leader of the Sabine people.
Thank you so much.
Thank you. Good afternoon, ladies and gentlemen.
Good afternoon.
My name is Sone Mulembe Mugoya, Deputy Chief Administrative Officer, Namayingo. Allow me to recognize all the leaders from the district local governments. Thank you.
You're most welcome. Over to you.
All distinguished guests, good afternoon to you all. My name is Namtevi Jacqueline. I'm representing the young people of this country. I'm from O3 Plus Project, Our Rights, Our Lives, Our Future, sponsored by UNESCO. All the young people, hi.
Hi. Well, thank you, Jackie. So we will have this conversation in three. One, we will understand from the young people themselves who live these issues on a daily. We want to hear them. We want to hear their voices because it's their platform. And then we'll also later on look into accountability. We want to understand what our policymakers are doing, what our law enforcement body is doing. And then later on, we'll also look into the cultural aspect to understand how culture is being, improved to respond to some of the challenges that adolescents and young people are facing. So on that very note, I'll start with you, Jackie. Hi, Jackie.
Hi, our moderator.
You can say hi to them again.
Hi, the young people.
Not only the young people, everyone. Yeah, so Jackie, I want to start from a young people perspective. What do you think is that, most urgent barrier that is preventing adolescents and young people from accessing services, especially services on sexual and reproductive health? And if you could also kindly paint a picture for us and for everyone in this, audience to understand how that barrier looks like, it will even be the better. Over to you.
Okay. The barriers that young people face, the one I've worked with or the one where I live and in the country, is stigma. Most young people feel stigmatized, feel whenever they are seeking out for sexual reproductive health for them, in a way that young people may be raped, defiled, they have mental issues, they have to know about sex, and we, the elders, the community, the parents, be like, what are you asking? For example, the young people may be affected sexually, and then the mom will be like, when did you start sex? Did I take you to school to start sex? Young people may have depression, stress, anxiety, mental disorders, and we, the elders, when they speak out or they seek for our support, you'll be like, do you want to run mad? Do you think you are the first to mental disorders? What are mental disorders? So these young people have a lot of issues, but because they are judged, feel they are going to be ignored, and that's what is happening. They feel not going to speak out. For example, a child of 15 is going to get into sex, get unprotected sex, because at home, condom. For example, how many of our mothers and fathers, the 15-year-old daughter comes and asks, Mom, what is a condom? What is a contraceptive pill? You're going to be like, who spoiled you? Where did you learn that? And where she learned that, it's because you are going to judge her. You are not going to be free to talk to her. Dear parents, dear stakeholders, let's give information, because the young people get wrong information from other places because you were being judgmental. Young people seek out, for example, last week, a 16-year-old to abort. She didn't know she was pregnant until 6 weeks. I was like, why can't you tell your mom? She was like, no, I can't tell them because they are going to kill me. Can you imagine killing your own daughter? Dear parents, dear stakeholders, dear leaders, stop judging young people. Let them, you create a youth environment whereby they can access this information freely. The other one I can say is, parents, from home, you don't tell us about sexual reproductive health. For you, you think we are young, we grow up, eat food, read books. When time for marriage, get married, and you must be a virgin. Seriously? You don't care about how we are. You don't care about them. You be with a parent and they don't know what's happening. Their child died because you are too busy looking for money. Yes, money is good. We want to study. But mama, daddy, auntie, these young people need us. They need you at home. Thank you so much.
Thank you so much, Jackie. So what we pick from Jackie's, discussion is actually that there is still more need for us to create safe spaces and normalize conversations around sexual and reproductive health, especially to our young people. She calls to action every parent in this room to normalize conversation around sexual and reproductive health with your adolescents and with your young people. Also, that it is very difficult, our parents to have conversations with us boldly around sexual and reproductive health. And she also asks parents, how many of you here are bold enough to have such conversations around maybe condoms with your, children or with your young adolescents back home? So we should stop, stigmatizing those victims that have already, suffered these challenges, but also make sure that we normalize these conversations, create safe spaces, and that will be, one of the solutions to challenges that brings us here today. Yeah, so now that is Jackie, and like I said, we are going to start with the young, people themselves to hear what kind of challenges they face. I'll now go to you, Kakoza. Kakoza is a young person living with a disability, coming from Tahi, right?
Yes.
Coming from Tahi. Yeah. So Paul, what are some of the challenges accessing sexual and reproductive health as a young person living with disability?
Thank you so much, Madam Moderator. To pick up from where my young person has spoken, as a person with disabilities, we suffer in different various ways, which are too challenging to even a person may not understand them. So I will characterize our barriers into just 4 letters. That is ACAP. ACAP stands for attitude, communication, accessibility, policies, or participation. To start with, let me pick up from attitude. Persons with disabilities are facing different attitude barriers that hinder them in accessing SRHR services. To mention, a person with disability, when he goes to the health center, the first issue they'll ask him, even you, why do you want to access this service? Why do you need the condom? If you give birth, Why do you want to get family planning services? This is all about stigmatizing them, which makes them to feel uncomfortable. And this one has been rampant, starting from even healthy workers who lack knowledge on how to handle persons with disability. This still remains a big barrier. That's why every time we are seeing bigger numbers of HIV increase among persons with disability. This report was made by even Ministry of Health, where they said that persons with disabilities are increasingly being affected with HIV. But the issue is the attitude when they go to the health centers to pick these things to use, like such as condoms, PrEP, and many other things, they're not given to them due to the attitude these people have towards them. Coming to accessibility, you may find a person like me with a visual impairment, I'm entering a hospital to access a box where they put condoms. These things are always hidden, which makes it inaccessible for me to access them. And if I end up asking either someone, don't you see, can't you check there? So such things really stigmatize me, and the fact is it becomes a barrier for me to access these. When we come to communication barrier, this one I'm speaking it in a line of different health centers where a person with a hearing impairment has gone to access a service without a sign language interpreter. This person is not given attention, is neglected because there's a communication gap. But unfortunately, we are all youths, and this makes us suffer, first of it all, as a person with a disability. That's one. If I'm a girl, I suffer also my challenge of being a girl, and also my challenge of being a young person. So 3 things into one person ends up affecting me. When we come to participation, when you look at participation, young people with disabilities are not included in these safe spaces where they can be able to express their feelings, where they can be able to speak things that are unto themselves, which ends up people getting us to decide for us, which feel like is a barrier. What you may decide for me is not what I may need. To us, we have a saying, there's nothing for us without us. And the fact is, in this health sector, there is no way you are going to suggest it for me, yet I'm not involved. We believe this remains a big challenge affecting persons with disabilities.
Thank you,
What do I say? There is a need for us to embrace this and be able to champion the rights of persons with disabilities, because regardless of any other thing, we have a right to a good health. Thank you.
Thank you so much, Paul. Thank you so much, Paul. So you can tell from his discussion that is still a very huge barrier, and we need to do more to make sure that we address it. So still picking, and he actually also emphasizes the issue of inclusivity. We need to include these young people in our conversations. We need to give them the platform. We need to stop talking about their challenges, but start talking with them so that we can understand some of the issues that they face and, find solutions to them. So lastly, from a young person is Nyamburu. Nyamburu comes from she's a young person from school. We had a young person from the university, that's higher education, and now we have a young person from school, Nyamburu. I want to pick from you, what are some of those most pressing challenges that you think young people in schools, especially in your community, are facing, and what do you think can be done by the different sectors here today to address those challenges in 3 minutes?
All right, thank you very much. Hope I'm audible enough. Speaking from a perspective, I'm doing a lot of advocacy in schools, and when they talk about I'm from school, that means I'm doing a lot of advocacy with actually the higher institutions, that is primary and secondary schools. So some of the challenges that are here when we relate to SRHR, we have challenges of early pregnancies that are still prevailing. Truly but these things still happen just because of things that are happening. And I would take this to be to the knowledge gap that is still happening in schools. There are that actually I would call them like strings attached. If at all someone comes in to say, maybe let me offer this information to these young people, true, it's age appropriate, they don't know what to do, but they reach a point of their even access the information. Hence, going into issues like early pregnancies, hence the increasing rate or the stagnant rate of teenage pregnancies. Then we have mental health, actually mental health conditions like psychological distress, stress, depression and anxiety. That really is still a pressing issue in these young children where a lot of things have not yet been done. I personally currently do more of mental health advocacy in schools, but there are those hidden secrets, those hidden stories that these young people never talk about. They are still pressing them down, but they don't know even to whom should they report to. And all this acknowledges to the place of, actually to the issue of the knowledge gap where they even don't know the referral system. Then we have GBV and sexual assault. It's GBV. If we relate to a lot of issues that are really affecting young people, you come to notice that we have issues like gender-based violence at a certain point that is physical, psychological, emotional, in a way that one cannot really understand. When you hold conversations with these young children, this is where they are going to open up and tell you, you know what, my uncle mistreats me. My mom oversends me and she's giving me, but I even don't know to whom I will report to, because when I went to the maybe vice chairperson of Chalobi, when they got money from this guy, they didn't push on the case. And there are still issues that are happening. Without wasting further time, I would like to bring on these points to be at least acted on. One of the solutions would be integrating comprehensive sexuality education and mental health in the school curricula. This thing, I think it has been quite integrated, but then it's not active. I'm requesting for active integration whereby they are really done, and at schools we really have sessions of mental health or comprehensive sexuality education, age appropriate to these young learners who are, they really don't know what to do. So it should be down on the ground level, and we leave things but also bringing it down. Then to continue, I would request for more peer educators. I really like the vibe of young people addressing young people challenges, because they really know what's hurting them and they can easily relate. So at a certain instance, we need to level down peer education at all levels, because they easily open up and they easily discuss with fellow young people. Continue, I would urge for provision of accessible youth-friendly services at our health centers, and also for them to be known by these young people that if at all I get a problem, at least I know somewhere I have to go to. Maybe at school they might not bring this information due to certain strings, maybe age appropriate, but then in actual sense, things are happening. So maybe I know somewhere at a youth-friendly center where I can go to. I personally sit at a youth-friendly center at Wambo Health Center, and I receive such cases from as young as primary students.
Okay, thank you, Martha. Thank you, Martha. We are running out of time. Kindly summarize.
I try to summarize.
Okay.
Okay, thank you very much. And also something, it's not too new, but also to open up community open spaces for these young people, actually community safe spaces for these young people to openly have conversations and know how best they can go about them. Thank you very much.
Thank you so much, Martha. Young people addressing young people issues is what we pick from her. But also, those have been our young people today. Like I said, we'll start with the young people that face on a daily, and also later on, now we want to understand from the accountability part of it. And I'll start with you, Commissioner Maureen, all the way from the Uganda Police. We have a law enforcement, agent here. We want to understand, Commissioner Maureen, sexual gender-based violence and child protection failure are some of the causes and are some of the root causes of unsafe motherhood. We want to understand from you, what is the police doing to make sure that they address, what is the Uganda Police doing to make sure that they improve their response to sexual gender-based violence, but also, but to also issues of defilement, especially dealing with minors, but only not understand that from the police, some officers hinder reporting of such cases. So you want to understand from your perspective as a commissioner, what is the Uganda Police doing to address
that issue?
Thank you, moderator. Wow, police is doing quite a lot, but in most cases, people do not know much information about police. What is only attributed to us is tear gas. But right in the background, we do so many things. The department that I head, its cardinal role is to raise awareness in the community. We speak to most stakeholders, but parents, the local leaders, and the partners that do work in that area. So we give out information on what police does, the key functions of each department. For example, we have a department that deals with sexual offenses and children-related offenses under CID. Then we have Child and Family Protection Department, we have community policing, but we also have departments like Women Affairs, though it's inward looking, but it also gives out information to various people. But the challenge we face is that even if we give out information, people still fail to come and report these cases as soon as possible. And one of the other challenges is that there is late reporting because people are either negotiating or they want to handle issues on their own, or they want to handle cases out of the formal justice system. But ideally, when a sexual offense happens immediately, you're supposed to report at least within 72 hours so that you can get the information that is required. So we, from time to time, we engage the communities in markets, in churches, in schools, and among the communities where the parents are. Then the other issue is providing specialized training. We have professionalized. We have the departments of child and family, and then that one under CID. We give them information on how to handle survivors. Like the young adults have said, they get traumatized. So once they come to us, we make sure that we provide a friendly environment where they can be able to open to us. We lower ourselves to that level because we have been trained to specifically deal with these teenagers. But there are a few officers, especially the ones that you find at front desks, call them counters in a layman's language. They may ask inappropriate questions and which sound judgmental. There, we still have a gap, but with our partners, we are trying to address this. We have developed modules on gender, on human rights and child protection, and we've included them in our training curriculum. That means that any police officer who joins the police force is trained to make sure that they're aware that GBV exists and they get to know how to deal with such survivors once they come to our police stations. Then we have strived also to improve the investigation processes. We educate the community members to make sure that they preserve scenes of crime and evidence that is needed. There is information that we really need immediately as soon as any rape or defilement has taken place. But if we lose out on that information, we may not be able to plant this perpetrator at the scene of crime. So we want them as soon as possible to preserve that, that environment, but whatever material you may pick, you can bring it to police. But we also encourage the victims of sexual violence not to bathe, because once you bathe, you wash away the kind of evidence that is. We support the victims or survivors in terms of counseling. We are not professional counselors, but we identify the needs. What do they need? Is it psychosocial support? Is it economic? Is it education in nature? Is it legal services? Then we map our service providers that we do work with, and then we do effective referral so that they can get this information. But we also do that in collaboration with data collection because it gives us information on where these cases are most prevalent. For example, the annual crime report of last year, 2024, we registered over 12,000 cases of defilement.
Wow.
And I don't want to look at these as just cases, but they are young faces both boys and girls, behind these statistics. So the 12,000 cases are quite so many, but remember these are the only ones that are reported at police. How about those that never get reported and people are busy negotiating? And we still see that there are very few cases that go to court. Out of the 12,312 cases that were reported, only 749 convictions were secured. So you ask yourself, what happened to the rest of the cases? 454 cases were dismissed, and 2,744 cases were not proceeded with. What does report a case at police? You either fail to follow up the case, or it is negotiated outside court, and it just stops there at police. So this is a very big number which we would want to address. And something very traumatizing, we see 8,240 children below the age of 14 being defiled by parents, teachers, the relatives, the shamba boys, the housemaids. They're defiling our young children and infecting them with HIV. So these are the issues that we need to address. As I conclude, we collaborate so much with partners, and I would like to thank Ministry of Health for bringing police on board. When we are dealing with these cases, it doesn't entirely rest on police alone. There is a part that we play, but there is also a part that Ministry of Health does, Ministry of Education, Ministry of Gender, ODPP, we look at judiciary, everyone, the cultural leaders, the religious leaders have a role to play. So we do not work alone, but we work as a team and make sure that we put the victim or survivor at the center of everything. Thank you.
Thank you so much, Commissioner. So statistics really continue to threaten us, but to also highlight the need for us to continue doing more work and never stop doing what we do. Thank you so much, Commissioner Maureen. And at that very point, I think I'll take you, our dear Chief Administrative from Namayengo District. We understand that you're coming from the local government, yeah? And then we know that sometimes policy is often disconnected from ground reality, if you and I, can agree. But from that very point, we want to understand, as the local government, how are you ensuring that multi-sectoral approach for adolescent health is translated from, being just a document to a lived reality?
Thank you very much. I'm going to speak from the perspective of the districts, but also from districts that are hard to reach. Like Namayengo is 70% water and 30% mainland, but also districts that are at the border. They have unique challenges, just like Namayengo has a high burden of adolescent health issues, a high teenage pregnancy rate at 28%, higher than the national level, but also with the high levels of gender-based violence. So as Namayengo or any other district, we have policies, and the policies we have, we may call them unreal or a dream, but with the multi-sectoral approach, it is now a reality on ground. You'll agree with me that the role of local government is majorly a coordinating role. Coordinating the ministries, government agencies, the civil society organizations, the communities, and other stakeholders. And we have a role to deliver a comprehensive package of services that are youth-friendly, they are impactful, and sustainable. That's the role we have to play as local governments. So we are actually the drivers, the pilots of the multi-sectoral approach. The local governments are focusing on a number of interventions or approaches. when we are to deliver services that are friendly. I've been asked to speak specifically about health, but since we are multi-sectoral, allow me to speak about other sectors. Like we have education, which is very critical. We have water, works and technical services. We also have community-based services. We have security, and then production, where we look at younger people being in safe, gainful employment. That's labor. So we have to do all this, ensuring that all our services are timely, very accessible, and very friendly. But now let me go specifically to the health sector. As local governments, for us to transform policy into actionable interventions, we identify, the first thing is to identify the needs of the younger people. And we don't do this only as local governments. We have support from the civil society organizations. And allow me at this moment to recognize UNFPA, UNESCO, UNICEF, UNAIDS, and then the World Health Organization. You're supporting us through different organizations at the local levels. We salute you. Namaingo, we have Naguru Teenage Center doing great work, focusing on issues affecting younger people in health, in education, and others, skilling, among others. So for us, we first identify the needs, and then mobilize resources from government and the civil society organizations.
Okay.
We do this by engaging the younger people through their representations, right from local council ones. We have youth leaders, youth councillors, we even have youth MPs. So we engage them and we allocate resources looking at the priority areas. These budgets will ensure that we follow up through the different entities to ensure that there has been compliance and accountability. Doing that, we definitely realize positive impact because our areas will speak for themselves. So that's what we are doing as local governments, and our role majorly is coordination and then mobilizing resources, ensuring that young people participate in issues that affect them.
Thank you, Ms. Soni. We are running out of time, so you will forgive me for cutting you short. But we also want to hear from the culture leader. Well done on the great work that you're doing in the community, Ms. Soni, and I think we need to give her a round of applause. So lastly, as we conclude, we need to also pick from the culture leader. We all believe that we need to make sure that cultures improve and evolve to make sure that we address challenges that our young people face. So our culture leader, all the way from Sebei, we want to understand how can traditional leaders, especially from your area, become the biggest advocates for adolescent self-motherhood, especially adapting culture norms, and specifically issues around early initiation into womanhood and early child marriages. Over to you.
Thank you very much. I think as custodians of cultural norms, we have a very, very big responsibility in this exercise. And I think earlier on, one of the challenges that was cited here was that cultural practices negatively impact on the health and well-being of adolescents. Now, in the case of Sebei, we as a cultural institution are tasking ourselves to look at how we form the whole cultural landscape to address our way of life of the Sabine so that we can adapt to the modern way of life. Because it is inevitable that there is a lot of change our traditional way of life has been seriously impacted by the influence of other cultures, by communication today. So, we as a cultural institution, we are looking at how we can reform cultural norms so that we adapt to the modern way of life without losing some of those basic values that we inherited from our ancestors. The most challenging, and I think which everybody talks about the Sabine, is the female genital mutilation. Here, we as a cultural institution, we are creating or establishing a new alternative rite of passage, because female genital mutilation was part of a rite of passage for young women to become adults. But now we are saying we want to mentor, train, equip our young women with necessary life skills through a process of a rite of passage, but which does not include female genital mutilation. So we have developed a curriculum, and we hope that possibly next year we shall start implementing. And for us in Sebei, this is an extremely critical area, because we hope to address issues of what? Of teenage pregnancies. We hope to address issues of early marriages, because these girls will go through a modulated mentoring process over a period of time, where they will be mentored by well-trained mentors and counselors to equip them with knowledge so that they can make decisions for themselves, which are based on information, scientific information, and also our information, so that as they complete the curriculum which we have now developed, there will be women and adults who can actually be responsible mothers and who can contribute responsibly to our society. I think this issue of female genital mutilation was harmful because of the trauma it causes the women. But for us, we didn't have issues of child marriages. We didn't have issues of early pregnancies or teenage pregnancies, because there was no woman who could practice or have a relationship, a sexual relationship, before they have undergone that process. And that process would normally take place after 17 or 18 years. By then, they would be becoming adults. But now we are going to replace this with this SWAROP, Sabine Women Alternative Rite of Passage. That is how we are organizing.
Okay.
And also, I want to add this. We have, in the Sabine cultural system, the clan, we are based on clans and families. And we have instituted serious disciplinary committees within our clan structures, so that issues like wife beating, if you become notorious in wife beating, the clan disciplinary committee will administer some punishment to you as a way of curtailing you causing what? Causing abuse, gender-based abuse. And I think using the structures of the cultural institution, we have many opportunities, we have many ways in which we can actually the well-being of young people.
Thank you so much. Thank you so much. I like the fact that you're actually replacing it.
Yes.
And I hope we get to see the fruits of that replacement. So as we conclude, just for us, you know, whenever we get such spaces, people tend to speak, but at times we forget that we also need to be held accountable for what we so as we conclude this, you know, amazing panel, I want to get a single commitment sent panelists, Ms. Maureen, Ms. Cow, and we just want what you're going to be doing, you know, as our policy in the next, to make sure that all these here are addressed.
one commitment that the police, because we realize that people out there need information. Laws keep on coming on board, but we also need to communicate them to the community in the most simpler way, give them information, tell them where they are supposed to report, how and when, and most importantly, to follow up the case. Don't report and say, I've done my part. You have to follow up. Their own, but we must work as a team. Each of us be committed to our work, that we help the victim who is at the center of it all. And we must also make sure that we do the prevention. We are not interested so much in response. If it happens, yes, we shall respond. But we so much want to prevent it, to engage the male out there, both men and boys, to make sure that you help us spread the gospel. If I speak as me as Maureen, they will say, but I believe if I engage the male who have a lot of that with men as partners, but perpetrators.
That's our commitment from the police. When we come back, we hope those issues are going to be, dealt with. One sentence. You're just making a promise. Yeah, over to you, Ms. Pony.
Thank you. As local governments, we are committed to following up on implementation and ensure compliance and accountability of policies and laws designed to improve adolescent health and well-being through youth participation, capacity building of frontline workers like health workers and health and well-being through increase
right from the for her.
That you've for us, we are committed to ensuring that we implement this alternative rite of passage. And we shall need
brings us to, the end of the dialogue. Not any role to play back there in our spaces, and let's continue doing that. Once again, my name is Brendan, Councillor Brendan Katushabe. I am a young person, I am an SRHR activist, and also a team leader for Own Your Future Campus Initiative. What we do back at OIF is active advocacy on SRHR issues.
Thank you so much, Brendan. Let's and I believe we've picked something, that some of the things, some of so over to you.
Very big task, a 1.5 session with 5 presentations. Ordinarily that would have been, but I will be allocating less. My name is Lina Tuyambi with the School of Public Health. I'm an associate professor there, and I'm very, very glad to be here in the work I like to do all the time. So we have come. Peter Clever. Also have other delegates in abstracts, out of which they were rated, they were reviewed by and are going to present were selected because and then you introduce yourself briefly, just maybe 20 seconds, and then you dive into the presentation. I prefer to be strict so that we save some minutes because of the jam and also the activities ahead. So without taking much time, I would like to invite the first presenter, Michael Waswa, and he's going to be looking at very interesting areas of mental health. We also have areas of adolescent health related to pregnancies. So say your presentation, introduce yourself, and you don't have to go into the background a lot, just background, just present objectives, how you did it, one slide, 3 key results, and then you conclude. With that, we shall save the time. Thank you very much. Over to you.
Michael. I'm a clinical psychologist, and I work with a transcultural psychosocial organization, which is a few kilometers from this hotel, just at Wamala Close. But I'm based in Gulu office. I hold a master's in clinical psychology, but also a psychology. As displayed on the screen, we've known that we've had a number of panelists here talk about mental health. And I think it is one silent cancer that at least we know that is not spoken about. However, this is the right time to advocate more about it. The title is around post-traumatic stress disorder. This is a condition that definitely affects most people who have gone through traumatic experiences. Majorly we'll see the refugees, the refugee community, but also even us as Ugandans, there are those traumatic experiences that we go through, events in life, by losing a dear one through maybe an accident, and to mention. And then there is also a variable of social support, and then alcohol abuse. And this particularly looks at the population of urban refugee adolescents. And this research was conducted during my master's program. And in the 5 divisions of Kampala. And we know that the divisions within Kampala, Machindye, the Lubaga division, Nakawa, these divisions host urban refugees. I'll definitely go straight away, as our moderator mentioned. I will not go deeply into the background. I'll go straight away to the objectives. We had to explore on PTSD symptoms and social support, the linkage between PTSD symptoms and social support. And then also we examined on social support's effect on alcohol use. And then also we did an analysis of PTSD symptoms and how it impacts on alcohol abuse. And then also an investigation on social support as a mediating factor. Definitely here we're able to identify mental health risk patterns within the adolescents, and then also information related to adolescent health interventions. Conceptual framework, I should skip that to take time. Then the methodology, cross-sectional design, I mean that a snapshot. We are here in our audience, just a snapshot of whatever that you observe from you, hear from you. It's all about that cross-sectional design. And then the correlation is to find the relationship between the variables that have earlier on mentioned. The target population, or the sample size, was 368 refugee adolescents with that age bracket of 12 to 17. And we did also use data, structured questionnaires for collecting information from the participants. Then Pearson correlation to measure the linkage between the variables, and then the mediation via process macro using this SPSS analysis. Oh, it's a rush through. Key findings. So PTSD symptoms. It was found that it's linked to alcohol abuse. But you might see the results there, and you find yourself, if you really well versed with the research, it's that it is a very weak but strong, significant relationship between the two variables. We know that PTSD, when a person having re-experiencing symptoms, nightmares, the memories of what happened in life, the forgetfulness, the other hyperarousal symptoms like difficulties with sleeping. Then others may tend to develop suicidal ideations, and also others may attempt, all complete with suicide. And then these symptoms, if they persistently increase, it means the person also indulge into alcohol use, or even get into abuse or addiction. And that's why we got a positive result that the two correlate. The increase of present having negative, and that one of it is alcohol abuse. And then the other, another relationship that we investigated, that is social support reduces PTSD, and it was also identified that there was a fairly strong relationship between the two variables, because we know there are people there that are living with a traumatic experience in life, but there are those people they may reach out to seek support. But there are those ones totally without parental support, guidance, and even friends or colleagues. And then the other area is that social support reduces alcohol abuse. We know that, yes, if there is parental support, definitely this child, this adolescent will not go into indulging into those risky behaviors of abusing alcohol. But then we saw that in this research, if we go deeply in it, that the populations that we collected data from, there were Somalis, there were Congolese, there were Sudanese, Ethiopians, Eritreans, all these categories, there are factors behind all this. You find that cultures sometimes, like now in the Somali community, you will not find them use what? Alcohol. But then they will use another substance, like cat, what we call mairunji. Okay. My mind now has gone off, Professor. Social support mediates PTSD effects. This is more of we trying to find out, does really social support come in to mediate between when a person is presenting with symptoms of PTSD, post-traumatic stress disorder, and there comes in the component of parental support, then this person definitely, they will not go into this indulgence of using alcohol and abusing it. And it was shown that in this result that there was a significant positive effect on social support to the two variables, that is PTSD symptoms and alcohol abuse. So PTSD effect disappears with support. If there is no support, then the PTSD symptoms will constantly remain. And it becomes even a psychotic condition that may require specialized case management. Concluding, Professor. Yeah, strengthening the multi-sectoral approaches for adolescent health and well-being under the local NGOs and then also CBOs. Some areas that we need to look at. One, building strong adolescent support networks. We know very much that we have some support networks available, but we need to really build a strong collaboration and partnership. And then promote mentorship and peer group models. I saw some peer educators here as they were trying to roll out a skit. So we need to also mainstream in mental health education into their career and that they're doing at community level. And then also foster safe and inclusive community space, yeah, to mention as you see on the screen. Around mental health and substance use practitioners, we need to also look at promoting health coping and reducing drinking. Looking at psychoeducation is very key, educating people about trauma effects, and then also use of trauma-informed preventing strategies. Then to the education institutions and school psychologists, I'm very sure we have some teachers here, train this staff in trauma resilience, and then also how to encourage peer connection and emotional support, and also promote mental health in their curriculum. And lastly, healthcare institutions and training programs. We need to also roll out trainings to providers in trauma-informed care and trauma focus. Trauma-informed care, you go and read about it. There are two different areas that you really need to understand around trauma. And then holistic management of the adolescent mental health. And lastly, national and community strategy. Adopting a scalable mental health model. We have what we call Journey of Life for children. It is a therapy that can be rolled out in schools. And then we have an approach that is new into Uganda, and a TOT to it. It is community-based social therapy based in the Netherlands. And lastly, empowering communities to support the youth. Conclusion, the study revealed that link between PTSD symptoms, alcohol abuse in refugee adolescents, it highlights that limited support, especially from parents, can worsen the well-being that we are focusing on for the adolescent and making it essential for multi-sectoral strategies to prioritize family engagement and psychosocial care to foster health and most resilient adolescents. Thank you so much for giving me this time.
Thank you very much. A small modification. As a result of you taking more time, we have now changed that the presenters will be not presenting with the slides as such. So you present, mention who you are, the key objective, and what you found, maybe in 3 minutes, because we have to complete. I'm sure you did the work. With or without slides, you should be okay. Thank you. Nachitende is going to be the next presenter. He works with the School of Nursing. Thank you.
Good afternoon, everyone. My name is Nachitende Naswiba. I'm a registered nurse with a Bachelor's of Science in Nursing. I just qualified recently. I currently work with the Department of Nursing as a support supervisor of the clinical students while on ward. During my undergraduate program, I conducted a study titled Psychological Distress Among the Undergraduate Students at Makerere University College of Health Sciences. And why I did that study is because students are facing a lot of mental health crises, which has been noted globally according to research. And if you look at the research that has been done in Uganda, a few studies have focused on students regarding their mental health. So that was the aim of this study. And because, the study was done because we wanted to have implementations done to improve mental health, but focusing on students and focusing on different settings, because students in different settings face different challenges, and you realize that their mental health outcomes are different. So our aim was to majorly find the prevalence of the psychological distress among these students. And, we had initially included factors, though after the research, we didn't really get any factors that were associated to this psychological distress. We used the cross-sectional design because of the time at that moment. And we used a tool that is called the DASS, D-A-S-S. You can get it online. We looked at depression, we looked at anxiety, we looked at stress. That encompassed our psychological distress. So this tool looked at, it had 7 questions asking about depressive symptoms that occurred within the past 1 week. From our findings, first of all, we had a total of 398 undergraduate students that participated in this study, and a majority of them were male, and the median age was 22 years. And anxiety was found to be highly prevalent because 57% were facing anxiety. And then for depression, we had a prevalence of 42% and a bit lower prevalence of stress of 26%. So these results, of course, are alarming. Like I told you before, we didn't manage to get any factors that were associated to this high anxiety, the high stress, and the high depression, maybe because of the time and the kind of design that we used. So other studies using other designs could get different results from that. So what are the implications for what? Like I told you, it was undergraduate students, health science students. So these are the future health workers that are going to be handling the community. So their career is disrupted with that poor mental health. The career is like the university. Of course, the mental health services are present, but the students don't know that these mental health services are present. So the university could work hand in hand with the Ministry of Health, maybe to provide mental health specialists and make the students aware that these services are available to them. This study was conducted with the mentorship of Dr. Muhindo Richard, who is the current Dean of School of Health Sciences at Makerere University. Yeah, thank you so much.
Thank you very much for doing your best. The third presenter is Dr. Kagoda. Please come and make your presentation. 3 to 4 minutes, and you can do it orally. Just take 4 minutes. Okay.
Yes, good afternoon to you all. My name is Peter Clever Kagoda, a student of law at Nkumba University, as well working with the USYG in collaboration with DAV Youth Project in the areas of Eastern Uganda. That's with our base in Kamuli District and that of the main organization in Mukono District. Our research was based on the innovations in adolescent prevention to address the challenges of HIV spread in the teenagers, the teenage pregnancies, plus gender-based violence. However, I'll use the 2 minutes there. We have 4 minutes, I'll lose 2 minutes. Then the other 2 minutes shall be for the recommendations from my co-presenter, Nandaula Maria Tracy. The research is on the background that after our senior 6, we joined to serve in social entrepreneurship. We were to look on the issues which were affecting our fellow teens. And in so doing, we related the data in the community. We visited various schools, and even we made outreaches of teenage pregnancies, gender-based violence, and those affected with HIV, most of the teens. That's the background of the research, with the main objective of creating and exploring a documentation with innovative strategies in addressing these challenges. We use analytical measures in our findings. For example, the RRTCs, then visits to the special interest groups as has been already stated, and we have our results recorded in our reports. We found out the problems and the reasons as to why the teens or the teenagers are facing such challenges in the communities or in their schools and wherever they are living. We have seen, for the reference of teenage pregnancies, we have seen that most of our friends, the girls, ages from age 12 to up to age of 25, those who come from low-class backgrounds, when they reach, for example, the state of the universities or high schools, they find themselves in a struggle to look like the people they have found there. In so doing, some engage with sugar daddies, and some of them can engage with boys in the same age, but of which they presume to be of another social status from them. So in so doing, we are getting such challenges. So far, according to our research, we came out with various recommendations, which we opt these other institutions and partners of government in youth adolescent campaigns to deal with these problems, for example, the teenage pregnancies, to adopt such measures, and we have a clean environment, if possible. Let me invite Nandaula Maria Tracy to give us the recommendations.
Good afternoon. My name is Nandaula Maria Tracy. I am also a law student at Nkumba University. So some of the recommendations were to integrate health services. This aligns with the Sustainable Development Goal number 3, which aims to ensure healthy lives for all ages. Then maybe also to develop apps tailored specifically for adolescents, increase uptake on HIV testing, tuberculosis testing, reports on gender-based violence, and maybe teenage pregnancies. Then about still gender-based violence, one of the recommendations that was deemed to be of good importance was the positive parenting programs, changing harmful norms and reducing intimate partner violence. And lastly, comprehensive sexuality education, reducing violence and promoting healthy relationships. Thank you.
Then as we leave to the question, as we are engaging the teenage mothers and the teens from going to that way, we have a question. What are we doing to the products of the teenage pregnancies? Thank you.
Since they are young people, I chose to give them that extra benefit, but now we would like to invite Munyole Samuel to come to the podium and make his presentation. 4 minutes. Thank you.
Thank you very much, Prof. Good evening.
Good evening.
By the names of Munyole Samuel, master's student. Currently, I'm pursuing my master's in biostatistics from Makerere University. Part of the work that I'm going to present is part of my work that I did, that I'm doing, that I'm currently finalizing with as part of my research. So I did my research basically on determinants of unmet need for contraceptives and unintended pregnancy among adolescents. And being a student of biostatistics, my focus was majorly on the methodology. However much I was looking at the health aspect, the methodology aspect also is very key. So, adding on what the previous presenters have talked, have already talked about, that we clearly know that we still have a problem of unintended pregnancy in this country, and we have a serious problem of unmet need for contraceptive among adolescents. So that's the area that I was trying to focus on. And so I was trying to look for factors or determinants of unmet need for contraceptive and determinants of unintended pregnancy. And I found out, based on my finding, that prevalence of unmet need for contraceptive and unintended pregnancy is still high, with the prevalence of unintended pregnancy standing at 33.1%, and unmet need for contraceptive standing at 26.5%. And I found out that this is as a result, this is influenced by very many factors, both individual, household factors, and the community level factors, and that is the same for unintended pregnancy. They're also influenced by community level factors, individual factors, and the household factors. I also went ahead and used advanced method of analysis to try to estimate the causal effect of unmet need for contraceptive on unintended pregnancy. And indeed, I found out that adolescents who have unmet need for contraceptive are most likely to have a higher likelihood of having unintended pregnancy compared to those or to their counterparts who have the met need for contraceptive. So, what is the discussion or the conclusion from my finding? I found that out of these factors, the unmet need for contraceptives is still high, and as a result of it being high, there's also still high unintended pregnancy among the adolescents. So what are some of the recommendations from my findings? One, the implementers or other governing bodies that are majorly doing adolescents' work should strengthen school-based sexual education to help curb down the unmet need for contraceptive and reduce unintended pregnancy. Secondly, we should expand youth-friendly health services to our youths so that we can curb down the unintended pregnancy. Thirdly, because of the regional differences, I found out that the rural areas in this country are majorly affected by the ones high unintended pregnancy. So they should, the implementers or other bodies that are in this area should involve parents and the peers in reproductive health education. Then, as I summarize or conclude, they must be level interventions in all essential areas of adolescents' reproductive health, to help us curb down these rising numbers of unintended pregnancy. Thank you.
Thank you very much. I know you've been writing down your questions, your comments, and we are now going to the last presenter, Jessica Angwen, who will make about 3 minutes. And then as we go into the questions, I will ask Norbert to ask his question after introducing himself and saying something about what he intended to present. Thank you. She has one slide. You project it as she looks at it. IT?
Good evening, as we wait for the projection, which is already there. Good evening, everyone. My name is Angwena Jessica Ronna, the only lady from a very far place that is none rather than Bududa district. It is a very unique district, just like the person speaking. That is why she decided to come all along from Bududa and alone. Yes. So we are transforming futures and tackling teenage pregnancy in the Elgon region. When I talk about Elgon region, here I'm not tackling only Bududa as a district, but I'm handling around 17 districts. But for now, I'm interested in the ones which are highly affected with teenage pregnancy. Why am I talking about teenage pregnancy in the region? It is because Bududa and Namisindra are a little bit having higher than the numbers that the national level is having. What am I trying to say? I am saying here that the national number is only 24%. And you find that Bududa is having 26%. Namisindra is having 27%. So that really drew my attention to come and at least meet Commissioner today and address this issue as a coordinator for the region. Yes, the background, I have just explained that and I will not go to that. Methodology, I used both quantitative and qualitative research in this. We first made a run at the region and also at a district level where I got this information from. Results, you can see that one of the factors leading to this is one, we can look at things like influence. When I talk about influence, I'm talking about, inadequate sexual health education. For instance, you find that there is lack of comprehensive information to these teenagers in the region. We have things like inaccurate or accurate information. What am I talking about here, members? Like you find that to Bududa being a hard-to-reach place or district, and the person will talk about teenage pregnancy while showing these teenagers a different, can I talk about pictures and so forth and so on. We have things like stigma that is still under inadequate sexual health education. Some teenagers, they fear to approach us health workers, reason being that we are tough to them. Some of us are very rude. We are not approachable. We have economic hardships. You find that some teenagers decide to conceive or to get unwanted pregnancies simply because they don't have money to buy knickers. They cannot afford bras. These teenagers cannot afford sugar while at school. They can't buy soap. Their parents can't afford. So why can't they sell them soaps in order for them to what? To acquire this. So it's what I'm trying to explain in hardships. Thank you very much. In conclusion, we are really trying to call upon Minister of Health and other everyone, IPs who are there, who are in this house, who can help us to combat, to end this teenage pregnancy. Thank you very much. I am also a specialist in sexual and reproductive health. I have masters in sexual and reproductive health. I am a national trainer in sexual and reproductive health. I am a coordinator at the region. I am a secretariat, and that is it. Thank you very much.
Wala Magayo here.
He wants to greet you.
Yes. Second. Protocol observed. Ladies and gentlemen, good afternoon. I'm quite sure everyone is tired. It was an oversight. I'm the last presenter. I'm sorry, I'll take a split second. I want you to listen. So my abstract I'm presenting is about enhancing youth HIV/STI services through peer-led initiatives at AHF wellness centers. And my objectives were to, did I introduce myself? Yes, I'm rushing. So my name is Dr. Sambozi Nobat, and I work with the AIDS Healthcare Foundation. So objective one, I wanted to assess the effect of peer-led initiatives to STI screening among adolescents. And objective number two was to determine the prevalence of STIs in adolescents attending AHF wellness centers through peer referrals. The AHF wellness centers, I'll skip the methodology, and I got results. The AHF wellness centers, so far we have 2 in Uganda, and they offer free STI consultation and treatment to all, but this study focused on the youth and adolescents. My results, I'm going to present them to you in 3 categories. That is service uptake, treatment outcome, then gender and age analysis. Service uptake, we realized that of the 162 peer-referred youths, 78.4 were females and 21.6 were males. Needless to say, this was statistically significant, that a higher number of females was screened with an odds ratio of 3.6, which usually translates into a positive association. Those who know statistics know what that means. We also found out that 9.9 of the screened youths were HIV positive, a prevalence much higher than the national prevalence. Then when I look at the results from the treatment outcome, we treated gonorrhea and chlamydia, and the coverage was 93.7 for the youth referred by their peers, compared to 57.1 by the youth who are not referred by their peers. What does that mean? Peer referred, they tend to get more treatment compared to the other colleagues who are not referred by peers. And the possible cause could be because peer leaders are trained to link their colleagues into care or to seek care. There are also 26 youths that were treated for syphilis, and those were the only ones who are tested positive for syphilis of those who are referred by their peers. And all the 16 HIV positives, that was the 9.9%, were linked into care, and up to now they are getting followed up, and they are in care, receiving treatment. Results on age and gender, this is the last part. So in a twist of events, HIV prevalence was higher in males at 14.3 compared to 8.7 in females. Regardless, testing more females, if you remember. And there are no HIV cases for the ages 14 to 18. And if you're to get the prevalence in the remaining 19 to 24 years, the prevalence was even much higher at 13.3. So in conclusion, peer-led initiatives improve HIV and STI testing and screening. It increases treatment coverage, linkage into care, and peer-led initiatives have also demonstrated scalable strategy to reach vulnerable youth in their communities. So what does this imply? It implies that peer-led approaches can address structural barriers to healthcare, and I would recommend that we replicate peer-led initiatives to address most of the youth challenges in all our facilities.
Thank you for listening and thank you for the time. Oh. Thank you.
Thank you very much. And in the interest of time, we shall take only 3 priority questions, 1, 2, and 3. From this side, any hand? Any question? Okay, from the middle side, you are number 1. Yes, she's there. Then to my left, any question number 2 from the chief? So there will be only 2 questions and 3. Thank you very much. Ask your question very, very briefly, and then after the 3 questions, the presenters will respond, and we shall thank you very much after.
Okay, thank you very much, moderator. I'm Perus Mwesigwa. I'm here standing on behalf of Nimau NEC, and I represent Southwestern region. I teach at Bishop Sturt University. Presenter number 1 talked about alcohol abuse, and I've been carrying that on my head every time I get in touch with the youth who is drunkard. I feel very bad inside my heart. I just think of the youth, about alcohol, how it is affecting them. Even when I'm in class teaching, I just say kindly, don't involve yourself in alcohol. He has talked about it, but he hasn't given a solution. Now, members in the House, what can we do to save the youth of the nation? Maybe another thing I wanted to talk about that has been abusing me is our youth, they don't understand what sex is. You know, these goats you meet in when they are grazing them and the cows, they just pray sex anyhow. So members in the House, the young youth especially, kindly understand the difference between sex and marriage. But my main question was about alcohol abuse. What can we do about it, members in the House? Thank you very much.
Thank you very much for your question.
The Chief.
Your Excellency or Your Majesty.
My question goes to the lady from Bududa. I also come from Mount Elgon region, and we have this challenge of teenage pregnancy. Now we are dealing in an environment of scarce resources. What do you think we should prioritize? Economic interventions to alleviate poverty in order to reduce teenage pregnancy, or we prioritize information so that they can make better decisions?
Excellent. That's very precise. Thank you so much. Economy or information? Last question.
Good evening, everyone. It's a pleasure being here. Mine goes to everyone, especially Ministry of Health. They have talked about people with disability. I have worked as a community linkage facilitator. I'm also a peer leader for AHF, that is Uganda Cares. There are some things that I've witnessed, and I would like to discuss with it and see if people can help out the community and the youths in our community. First of all, I want to talk about people with disability. At the site of government health facilities, I've witnessed that they do not have representative, people who can interpret for them. As per the law, it claims that we have equal right and we have to choose where we are supposed to get our health services from. But you realize this is a fact that has been ignored for a long time. We don't have interpreters for people with disabilities, especially those who are dumb and deaf. That is number one thing. And also, I want to cut across about the according to the procedures of police and health procedures, for us as youths, you as our leaders or our elders should understand us from our own perspective. The long procedures that are there in the criteria that for us we have to go through, they are too long for us to access what? These services. That is one thing I want to cut across. I think basically those, though I've forgotten some.
So thank you very much for your questions, and I will now ask the presenters, one on alcohol and its effect, come and respond from there.
Yes, thank you. I think it was a quick through from my presentation, but most of this was really presented, particularly in the sector of education and school psychologists, where I highlighted that there should be trainings to the teachers, mainstream, so they can manage issues that present within the school and in class. And one model that I wanted even to talk more about, we have the simplest model called psychological first aid. Psychological first aid, this is where you as a teacher, any vendor on the market, any person on the way can utilize. It is more of you talking to this person, listening to them, trying to address the immediate distressors. There could be emotional distressors. And in this, if you find that this individual, this child or this adolescent is able to manage, definitely there are referral systems in place where you can.
At the early age, we are going to engage the DICA team, whereby we shall engage police. I'm happy to recognize police because I've seen a very handsome gentleman dressed in a full uniform, representing all the policemen in Uganda. We are going to engage other stakeholders like...
so information, I think that's a lot about
Thank you very much. Thank you. Yes.
Any of you can respond to her about the question that she asked related to the long procedures at the health facilities, etc. Who wants to take that? Any of you who wants to address?
I think, Professor, this is a question that cuts across even, the people in the audience. But to note that processes, definitely they are there and they will remain there. So as you as a service provider, have you taken an initiative of moving with these beneficiaries to those offices? Do you work along with them? The best way of long procedures, work with the individual, support them, and that will be the best way of dealing with long procedures that take long to be managed. Thank you.
Thank you very much. Anybody from the ministry who wants to make a comment on that? Or otherwise, I will thank you. Okay, so I think it can be integrated in the next session. So,
all right.
Where are you?
No.
Oh, okay. So thank you very much for being very attentive, my presenters. We clap for you.
All right, let's give the presenters a big hand, ladies and gentlemen. Thank you.
Thank you, audience, for listening to us.
Thank you. Ladies and gentlemen, can I request all of us to stand up on our feet, if you can? Stand up on your feet if you can. Emera bijere byawe. Yemerera ku magulu go. That's all I know. Please stand up on your feet if you can. We are coming to the real tail end of our program, and without wasting any much more time, man, you remind me of that famous lady, Agnes Nandutu.
Tonight.
Over to you, Pablo. Pablo wants to say something to us, and thereafter we'll hear from the Miss Uganda Foundation, and the DG will be coming in to give their remarks, and we close the meeting.
If you're happy and you know, say I am.
I am.
If you're happy and you know, say I am.
I am.
If you're happy and you know, and you really want to show, if you're happy and you know, sit down. Just wanted you to stretch a bit. Ladies and gentlemen, let's clap for our presenters, all the panelists. But most importantly, I want you to put your hands together for today's VIP, who happens to be none other than you. Clap for yourself the way you feel about yourself. Now, if your neighbor didn't clap for themselves, clap for them. Because the Bible says, love your neighbor as you love your what? As yourself. Well, thank you so much. My name is a family of 16. That's minus dependents. Yeah, one time I asked my mom, did you really have to have all this? And she told me it was family planning. So I asked her, what kind of method was that? She told me you can't get pregnant when you're pregnant. I said, wow. I said, wow, imagine that. I said, I think I should also use that method. Then I remembered the school fees, you know. But while all this was happening and we were talking about reproductive health issues, and you know, they were mentioning condoms, and something sparked in my mind. I said, imagine, just imagine, if companies or NGOs decided to use their taglines to promote these condoms, I'm sure the young people wouldn't be afraid to buy them. One of the hardest things to buy is a condom. Young people, you go to the shop, you find the attendant is your relative or a friend to your auntie. Where do you start from? Yeah? But imagine if there were companies or NGOs using their taglines for condoms. For example, MTN. I want MTN condoms everywhere you go. You know? I want UNFPA condoms. My body, my life, my world. Imagine NTV condoms standing on your world. You know, it would be very easy for them, you know, to purchase, you see? Yeah? Things like that. So I think it would be very interesting. Well, we have young people here who came from schools. Thank you so much for representing those who came to school. I went to school, but I successfully failed math. I don't know whether I was the problem, whether it was the school. I've never known up to this day where the problem was. Or it was me who was big-headed. One day the teacher asked me, Pablo, what is 27? Now, because I was a child, I said 2 plus 7 plus 1. I said 10. The man came to me, Chiwako, serious. While he was beating me, the headmaster found him and said, how come, why are you beating Pablo? He said, Pablo doesn't know what 27 plus 1 is. And the headmaster said, what is it? The teacher said, 271. The teacher looked at him and said, you're lucky, I thought you didn't know. So imagine, that's where the problems what? When you're dealing with, I successfully failed that, but I do believe that every occupation has an occupation hazard. While I was talking to the young people, they told me one of the problems is dealing with the herbalists. When you're telling them that people shouldn't get pregnant when they are young, the herbalists have their own decision. So they find it very hard to deal with young people, with some of us, the adults. And they even want to give up from being young champions. But don't worry. Never give up. It happens everywhere. We all have occupational hazards. Even if you were paid to sleep, at some point you'd give up. You'd resign. You'll have a nightmare. You'll dream about pigs flying and you say, I've resigned. Not so. Every job has an occupational what? Hazard. Even comedy. Hey! One day I was invited to go and perform in Juba. Let me tell you, I did my research about Juba. Little did I know that the people in South Sudan were also on YouTube watching what Pablo has said. They even did coursework. I went to Juba members. First of all, when I reached there, I was the shortest. I was looking up to everyone, you know. I said, what is this? When the show started, I reached there. They said, now, ladies and gentlemen, welcome, Pablo. I came, I cracked the first joke. They were laughing in installments. He he. The second one, he he he. And when my time was over, I said, thank you so much, that was my time. A gentleman stood up and said, no, Pablo, there are some jokes you've left out. I said, which ones? He said, yes, I saw on YouTube. There's this joke about the suit people. You know that one? I said, now, I thought he was joking. He said, there's this joke about the suit people. And he told me the joke, the way it was on YouTube from beginning to the end. And he said, you tell us that one. I said, but you have already said it. The man said, you tell us that one. And when a tall person strong starts speaking in installments, know you're finished. The promoter came running and said, Pablo, you tell the story. That one is the general. He will shoot you. When I heard of shooting, I started the story the way he had told it. I said, you don't shoot people. The man laughed. Even reached some point and said, wait, Pablo, there's this part you've left out. Then I said it. Then the man laughed. Then after, he asked his son, is that the joke you wanted? The son said, no, there's another one. Yeah! It was tough. That was, that was one of the toughest times I'd ever seen in my life, yeah? The other one was working on radio. As you know, Naguru Teenage Center also has radio dramas that we are doing to serve the people. Now, working on radio is also hard. First of all, you don't know whether people are listening. You don't know whether it's power. You know? You just come on radio, yo, this is yours truly, Pablo. Now give us a call on 703-426. We are talking about fistula. Give me a call. You wait, no one. Then you continue. Don't miss, in the evening we shall be having a dialogue at Naguru Teenage Center. A call, no call. While you're still there, a person comes running, hey, Pablo, we are off air. The machines have failed. It's also an occupational hazard, not so? Yeah, but we always, the reason we do this is to make sure that we are all on the same page, not so? There's always a first time for everything. I'll never forget the first time I boarded an aeroplane. Hey, nobody warned me. I go to Entebbe Airport, everything was okay. I reach Entebbe Airport. Now, you know, when you don't know what's happening next, you just follow anybody. There's a man I came with in the bus. When I saw him moving, I followed him wherever he was going. I was following. Little did I know he was going to the bathroom. Hey, I came back. Now, everything was according to program, put in my bags. Then we entered the aeroplane. Hey, a woman came and started announcing things related to dying. That you will see things coming from up in case the aeroplane has a problem, put on the nose. Hey! I asked my neighbor, what is happening? Are we going to die? He said, no, these things happen all the time. It's no routine. I said, no, this one is tough. Then the aeroplane took off, like the economy of Uganda. Now, while we were on the air and everything had settled, they started serving food. Now, where I come from, we believe that you have to pay for everything. So the lady came, she was serving, everybody was eating. She came and told me, will you have beef or vegetables? I said, no, I am fasting. Who fasts in Feb? I am fasting. Meanwhile, my neighbor was eating like he had been hired, you know, everything. Then my stomach started speaking French. Germar or ventre. Then my neighbor was concerned. My neighbor said, you man, at what point are you going to eat? So I asked him, how much is the food? He said, no, the food is on the ticket. I called the woman, madam. The woman came and said, food. Said, no, back up, we are landing. But thank God, there was a connection flight. As soon as I entered the other aeroplane, I didn't even listen to that lady who was announcing dangerous things. I said, you say what you're saying, I'm waiting for food. As soon as they brought food, the lady came and told me, will you have vegetables or beef? I said, both of the three, just bring. I'm telling you, I ate. My neighbors were concerned. My neighbor was from Yugoslavia. She even offered a cupcake. Can you have this? I said, you bring. I ate it with that guy. I ate everything. The air hostess was concerned. I was the only passenger who left that flight with a food flask. They packed for me. Yeah. So in life, you never give up. There's always a first time for everything. Back to you, Amon.
All right. A big hand for Pablo, ladies and gentlemen. Yes. Aha. Pablo. You see, there's that moment when you're on air and no one calls. And then when you're signing out, you say, thank you so much for listening to us. Now, who has been listening to you? Anyway, without wasting any much more time, allow me to invite the Miss Uganda and Mr. Uganda Foundation. Is it? They've told me they'll use only 4 minutes to inspire the young people and then thereafter I'll hand over to Dr. Irene, who will usher in the DG for the last rites of this event today. You're welcome.
As Pablo said, we shall speak in installments. And my name is Mohoza Chivya, L, Miss Uganda 2025, and I'm very honored to be here, and we are very honored for the invitation. I would like to, hi. Yeah, the young people are my people. I want to stand at the front lines with the young people because Miss Uganda Foundation was founded 12 years ago, and they focus on young women, youth, and children. And I believe this is to be at, and I'm very excited and honored to be here, and I can't wait to see the change we're going to make together. Thank you very much.
Good evening, everyone. You guys just had lunch. Good evening, everyone. All protocol observed. My name is Alinda Sean Michael, the first ever Mr. Uganda 2024-2026. I'm so honored to be here, and we give thanks to the Ministry of Health that has promoted this event, I think for 5 years now, if I'm not mistaken. And I'm so happy once again to be here. I've been given a few minutes, but let me try to use those few minutes to pass on a message. I've talked about many things, including mental health. I'm a mental health advocate, but I want to pass a message to the boy child out there. One of the key things in safe motherhood, we have what we call responsible fatherhood. I don't know if I'm right about that. I'm seeing a lot of fathers here. I'm seeing the fellow gentlemen here. And the fathers that have a male child, we should, actually, I encourage our parents to talk to us the more. So being a father just doesn't begin at bringing the child on earth, but also taking care of that child as a father, being a responsible father, being there for that child from that day the mother is pregnant to the day that the child is given birth and to the day the child gets out of your house. Pray we raise a responsible generation, responsible fathers, responsible uncles, responsible brothers, and responsible husbands. As Mr. Uganda, I'll forever advocate for a responsible gentleman, and I can't do this alone. I can do this with our parents, our fathers, and our brothers. Thank you so much.
Yes, good evening to you all. Good evening. I know it has been a very hectic day. I'll begin by thanking all of you for turning up. The Director General, we've had a whole long day where we started off with the purpose of why we are here. We then had remarks from the representative, the country representative of UNFPA. We are honored to have the chief guest, who among what he mentioned was the multi-sectoral collaboration. He highlighted the areas where we can jointly implement. He clearly stated the livelihood programs and the different documents that can guide us as we implement. We then moved on to launching the 3 documents, that is the National Adolescent Costed Implementation Plan. We launched the report, the Teenage Pregnancy Surveillance and Response Framework, as well as the annual Adolescent Health Report. This was then followed up with a walk. There was a number of exhibitors who took us through the available materials and innovations that young people are in position to deliver. We then had presentations, like you listened in from the dialogue, where we've picked a number of takeaway messages, among which were, to summarize, issues around knowledge gap among the young people came out strongly, especially young people in schools. Integrating mental health in schools was one of the key outstanding messages. Creating community safe spaces where young people can engage, where young people can have an environment that they can discuss and air out their challenges. The issue of capacity building came out strongly, and how post-traumatic stress disorder can come out in a way that if there is social support, we can have less post-traumatic stress disorder. So basically that is what we have had in terms of the discussions. We are coming up with a communique and a summary of what has transpired, and this communique will be delivered during the main conference. Because of lack of time and people having sat here for a while, we shall be sharing the details of the communique on Friday during the Safe Motherhood conference. DG, my task is to invite you to award our best performing, we have best performing young people, and I think that will come in after, but to recognize our dear partners that have supported us through the journey. But before, DG, you come in to make your statement and close this very important event, allow me in a special way appreciate the organizing committee. The organizing committee, please. But can we stand up, the organizing committee for this event? We had 3 subcommittees in preparation on top of the organizing committee. We had the scientific committee. We had the logistics and finance subcommittee, and we had the communication and publicity subcommittee. These have made this day appear as it is. In a special way, I would also want to appreciate our partners. I would not mention individual partner, but I would like to appreciate you all for the support. It has been a challenge getting this together, but with the work of the partners in all your various capacity, we've managed. So at this point, DG, allow me to use this honor to invite you as recognize our partners and then close this workshop. Thank you very much.
Once upon a time when I was young, and particularly when I was in school, the time I liked most was the time to go for physical activity. The next one was definitely time for lunch. And the third one was the time when it's time to clock home. So I'm also looking at that. Probably you are getting time to leave this place. So I want to recognize all of you in their different capacities, our partners, the people why we are here, the young people, adolescent and young people. Hi. Hello. So what we need to know that I think that we've spent the whole day really very seriously, and we have spoken what needs to be what? To be done. I have probably just about 2-3 things which I add, and if I had more time, I would have donated it to Pablo. Don't you think so? Because I think that's what young people like vibrancy. I think we've been keeping them very idle in this conference. I think young people. So Pablo, just be getting ready. Probably I would really again want you to get into this house. And if it is so, let's agree it's consensus. You know, this election period, let's just clap for Pablo if you want him to come back. One highest habit, you will be like probably who I am. I'm the Director General of Health Services. With young people, a young person. Decisions. I am sure that probably decisions I took were right what? Decisions. Yes, we will say that young people, adolescents, you have to experiment. I think you do chemistry and you get into all physics, science, it has experiments. But sometimes in life, just one experiment can tip you to the what? To the worst, and you not recover from it. And the other experiment, particularly for our female sisters, our daughters, is the pregnancy. If you get a pregnancy, it might sometimes end, if you don't get supporting parents, supporting community, it will become the end of what? Of your side. And it will now gravitate you to what they call poverty. Perpetually you remain in what? Poverty. So looking at some of my OGs, not that I went to Tricona, my daughter was once upon, she was there. I really want that when it is time, just like the Bible says, there's time for everything. So if it's time to be in school, let it be time to be what? Be in school. The other things can be able to do what? Patiently wait. I think you had those 11 years of school will make a very big difference. In additional years of school will even make a very big what? Difference. It will empower you in terms that you can make rightful decisions. It can empower you, you will get money. Nobody will drive you because of money, because you will have your own what? Money. You can be able to take care of yourself and your family. So we'll continue as a ministry and partners to commit to work. We'll want that you we'll reach you in schools, we give you information, because having 24 out of 100, you know mathematics, 24 out of 100 young people, adolescents, pregnant, is a very big what? Big number. We do not want to lose those numbers, and that's the biggest things. And if you survive a pregnancy, definitely you get probably, many people get into unsafe abortions. Then you get in safe abortions, 17.5 almost % of people, those between 15 to 19 who die is because of what? Sepsis and be related to abortion. If you stretch up to 15 to 24, almost 24%, which means a quarter of the people, the women who die in that age group is because of what? Of sepsis. And because of what? So you survive that. And if you survive that, then probably you might survive that in the future. Probably you end up getting a fistula. Fistula means that you are leaking urine, you are leaking stool at the same what? Same time. So my young people really would want that you kind of look and be able to say no and be able to reach. I know the young people say that, where do we report? Because sometimes the people who do this are people who are what? Who are very close to you. So we would want to look at that. How do we scale adolescent responsive services? How do we scale up life skills and health education? Commit yourself. As ministry, we are committing, also committing yourself. Let the ownership be you. Why should you not be like probably the next Director General? Why not? You need to be able to do that. So I want to thank the organizers, that we want that this definitely will continue every year. I know that there was a lot of activity, a beehive of activity. I looked at this, there are apps which people definitely digitally, we should be able to be able to look at, get that information, be able to reach you in school, be able to get you at home in communities. So let's be able to engage and mobilize communities and families. For the boys, most times we are said we are the problem. We are the causes of what? Problems. And I'm looking at that, if this is your own sister or probably your own daughter, what would you want? You just think, what will it mean? So what difference will it make? So that you look at that, if this was you or what happening to somebody about you. So let's be able to support. Let's be able to support aspect of menstrual health hygiene. Let's be able to support all the other aspects of mental health. The last piece which I want to speak is issues of drugs. issues of drugs. Our here, information she gives us that majority of the people in the alcohol and the substance unit are all, most of them are young people, and they are students. So we need to be able to look at working with the police and security. There are quite many pockets. So where students are accessing drugs. And so it might be just peer to peer. It might not be that you have done intentionally, but your colleagues will introduce you to what? To drugs. So you need to be able to be conscious. What group of company are you on? Because that person, that if it's a friend, is not your friend because he's not doing the correct correct thing to you. So if we can address those two issues so far, those are my two asks. Address pregnancy, address drugs and alcohol, and then we shall address all the others who would have probably changed the landscape of what? Of young people in this country. So your future, the future of your children, the future of the next generation will all depend on you. So you are the workforce of today and the workforce of the future. So we really want to do that. So to the organizers, I think definitely we need to plan better, and then so that we can be able to have this. I really would want to stop there and ask Kimuli Pablo to come in front. First give a skit, then I will officially hand over these awards to the people who are what? Be clapping. He might change his mind, he might go back. He has come. So thank you very much, and I take the pleasure. We'll hand over the thing, don't worry. But officially, the official communication for me has closed. Thank you very much for listening.
Check. It's not working. Hello? Check. Well, the hand mic has successfully failed, so you know they say when bad luck chooses, even a cold potato can burn you. Well, let's put our hands together once again for DG. Thank you so much. And thank you so much for loving young people. I think that's true patriotism, not so? I always tell people, love your country. The first thing you need to do is love your country. People, if you have traveled, I don't know, but let me tell you, I love Uganda. One day, my friend wanted me to go to Canada. He told me all the advantages, Pablo, if you go to Canada, you'll... I was about to accept. Then I remembered Uganda Chinyuma. Uganda is nice. Oh, no. First of all, tell me in Canada, you can't shop in traffic jam. In Kampala, Allah, you can buy anything in traffic jam. Not so. From groceries, you can buy groceries. If it's the season for grasshoppers, you buy grasshoppers. You can even buy car spare parts. They fix the wipers while the car is moving. It's only in Uganda where I've seen drivers who negotiate with traffic lights. The traffic light is saying red. The person looks left and right. There's nobody. Whee! Yeah. In Uganda is the only country where we don't have beef. Why? The lifespan of a story in Uganda is not more than 96 hours. Ugandans move on. Not so. You wake up one morning, they're discussing, hey, what has happened? Bobby Wine, what has happened to Bobby Wine? Hey, where is he? Why can't they? Raila Odinga has died. Hey, what has happened? Where? Hey, while you're still in that one. Hey, Bad Black. What has happened to Bad Black? You change channels. Hey, while you're still in Bad Black. Hey, there's Naguru Teenage Centers. Hey, now, be rest assured, tomorrow there's a new story which will come out, and we shall do what? We shall move on. Ugandans, we move on. And Uganda, I had mentioned this earlier before to a certain team, that Uganda is what was declared the happiest country in Africa in 2018. Ugandans, and we're the happiest in East Africa. Do you know why? Because Ugandans love. I've never seen people who love like Ugandans. Ugandans will attend a funeral of somebody they don't know. Honestly, you at your workplace, your neighbor has lost an auntie. Your workmate loses an auntie, not so? Sorry, condolences. You start collecting condolences. As you're still collecting condolences, by the way, there's a coaster going to, hey, put my name on the list. You see how you go to Kumasi to bury somebody you don't know? You're already going to do what? To bury, even reach there. Sometimes you even go to the wrong funeral. They say, this is a different one. It's, hey. Yes. I'll never forget one time we were at a funeral and a woman came crying without knowing who had died. She didn't receive the memo. She came crying, Wawe, Banange, Wawa Msaja Fude, the man has died. Wawe said, shh, keep quiet. It was a woman, it was a woman. Hey! Hey! This woman, Mama, Abana Barakedani, who will look after her children? They said, she didn't have children. Hey! Hey, Mama, who will take over the house? Who will look after the house? They said, no, she was renting. Hey! She ended up asking for porridge. You know, Buji, you know? You see, the beauty about that lady is that the intention was good, only that she didn't understand the circumstances. If you had got the right memo, everything would be in what? Uganda is the only country in East Africa where we have wedding meetings. People fall in love, you're not in love, but the people are falling in love, you start collecting money. Even the pledge becomes a problem. You haven't yet. But you know, they get married, whether they split or not, Ugandans do what? Move on. Man, in Uganda, I'll never forget the day when the government declared, I think it was in 1996, when the government declared that they were going to pay school fees for every 4 children in the family. That was a good policy. But it confused my village. Hey! My neighbor had 3 children. When the announcement came on, he turned and looked at the wife and said, have you heard the announcement? The wife said, yes, but we are not having another child. The man said, well, it's not about us. But you know, since the government is paying, I have a child in the neighborhood. So now the government is paying. The woman kept quiet. The man said, now is it my problem that you produced only boys? I had a girl outside. The woman said, I'm not complaining. You can bring your child. So the man went to bring the child. Upon returning, the wife was at home alone. And he asked the wife, where are the rest? The wife said, you think you're the only one who had the announcement? Their fathers came and took them. Up to this day, the village was confused. Everybody, the rich people suffered. Everyone was going, I think you're my father. Everyone was running towards them. Hey! You even created a situation. Can you see that my head looks like yours? Because you know you won't look at his head. And that's why, and that brought the realization that actually everybody is fighting poverty. Not so. Some of these challenges we are facing are out of poverty. Early pregnancies, you know. Sometimes parents just send the child there because they need bride price, you know. I hate poverty. Let me tell you, we are so poor that even poor people called us poor. You know that kind of poverty? Where you're so poor, you can't pay for anything, you can't even pay attention. They ask you, what's your name, eh? How old are you, eh? Yeah? You know that point where you're so poor that even the rats in your home gossip about you. You hear them saying, they're not cooking tonight. They go to look for food and come back to sleep. Yeah? But us were at least, we had a neighbor. For them, they were so poor. They were so poor that even the government, during the census, they didn't count them. They were not adding value to the nation. You know that kind? Yeah? So we should. And by the way, even poverty can manifest in your animals. Have you ever seen a rich man's dog and a poor man's dog? A rich man's dog barks with confidence because it knows what it's guarding. You know, it knows. Range Rover. You know, it even announces Mercedes-Benz. It even eats food in the supermarket, but a poor man's dog, it has no idea. What am I guarding? It has no backup. A rich man's dog has a backup. If it barks more than you, like, whoo, the owner comes with a gun. Where is he? But a poor man's dog, no backup. If it's barking, he will slap it. Shut up. There's nothing to steal. Thank you so much, ladies and gentlemen.
Ladies and gentlemen, let's give it up to Pablo. Yes. Woo. All right.
Thank you, DJ. DJ, pull up. DJ, pull up. You will never lose your mojo. He's the same Pablo I knew. Over to Dr. Mugahi and the DG. By the time he came in, he told me he will support you give out the awards.
Thank you, MC. Since our chief disclosure has already made the remarks, I thank you, Pablo, for breaking our ribs. People are still laughing. They may even laugh till tomorrow. I want to move a vote of thanks to our partners who have been to support the different groups and put this function together. Our Director General had already appreciated you, but we want to thank you wholeheartedly, especially those who have been able to support young people move from up country to come and attend this conference, and also be in Kampala. I've just met some young people from Lamu. Some of you don't know where Lamu is. I also want in a special way to appreciate the members of the Adolescent and School Health Working Group. And that's the reason we are stepping here this evening to appreciate you in a special way. I want to say that all of you deserve presents, but it's only 10. We are trying actually to look for a criteria of how to give them out. But I think those who will not receive a present today, your reward is already in heaven. It has been registered. Amen. So don't leave here when you are not happy. Your reward is already registered and onto your name. Also in a special way, did you allow me appreciate our multi-sectoral outlook, especially our team from Ministry of Gender, the Commissioner, Ministry of Gender. He's still here with us up to. Allow me also appreciate our people from the Uganda Police and all the others who really bring out the multi-sectoral component, because these are not ordinary technical working group members, but they make it look complete when they are available with us. And actually the police, we want to follow up so many cases of teenage rape and whatever that have not been well followed up, and we should be able to reach you for any assistance. Without repeating any speech, allow me ask Irene to give us the first present that we are going to read, and we hand over to the DG. And these ones seem to be all for the CSOs. It seems this team wants more money. The first award goes to Plan International. We want to appreciate you for your support to the young people. Plan International. Which song? UNFPA, kind of step forward to represent the partners. And Dr. Mutumba, come forward. I wish they repeated the dancing. Give them the real music. Young people need to show us energy. Thank you so much, Plan International. We really appreciate. The second is Naguru Teenage Center. Naguru Teenage Center. If you are smart enough, you can request for your own song, but we don't have a lot of time. Or you make your own music, or you tell Pablo to help. Naguru, there is no music. Next is UNFPA. Next is UNFPA. After receiving the award, you don't go back because we shall have a group photo. UNFPA. The next award is Right to Play. Right to Play. People, wait. Give them their things. Right to Play. Right to Play. The next one is UNESCO. We want to appreciate supporting the young people. We visited your UNESCO school at the back there for the young people, Makerere, Chambogo, Jinja. UNESCO, step forward. Maristops, be ready. Maristops, be ready. You'll be next. Maristops after UNESCO. Team Maristops, as SRH Alliance is also preparing. Team Maristops. Congratulations, Team Maristops. SRH Alliance, as Save the Children gets ready.
UNICEF.
Save the Children as UNICEF gets ready.
UNICEF.
Which one is it? UNICEF, anyone from UNICEF? AMREF, AMREF, if you are near, AMREF, step forward. Yeah. AMREF, if UNICEF is around, that's still okay. Help us. We want to use this. We want to use this. Yes, the rest of us, let some people step here. Chief guest, we shall be on the lower level. The rest most of us, let's go up so that each one of us is captured. The ones who are holding their awards be in the front. All of you don't need to be there. Let's mix up. The ones holding their awards, you can be in front. And then the rest of, I don't know, okay. Where is the balance line? I think at least we can see everyone. Okay.
Thank you so much, Dr. Ladies and gentlemen, let's give ourselves a big, big, big hand. All right. Thank you so much for making time for the conference tonight or today. It's been a nice time having you. My name is Ammon Muliowa, and it's always a pleasure being with you. We'll be standing up on our feet for the national anthems, and remember, yes, the young students, please, the photo moment, please. The students, we have evening tea served, so do not leave the tea with us, right where you had your break tea from. Whoever is a student and young, please, your packs for the Birabo are here. All right, DJ prepared the national anthem. And after that, we wish you journey masses back home. I usually say, if I don't see you again, Happy New Year and Merry Christmas.